Everyone, give me a minute here so I can pull up chat and get Little Rosie the link. Have to, let's see, let me do this. Okay. Okay, so I got the link sent to Little Rosie. All she has, let's see, I sent the link to Little Rosie, and all she has to do is click on that, and that should bring her in. It should open up her Google Hangouts and bring her into Google Hangouts. Let's see if I can get this positioned correctly. Get my volume up, and I'll pop out the chat. Okay, make sure everything else is off. Okay. Hello, everyone. Making sure all my volume is down on everything. Yes, ma'am. Okay, I got a little bit of. We're waiting for everyone. I just got a follow here for Twitter, so they might want to watch. So let me go ahead and accept that. Hello, Adriel. How are you? Welcome. We're just getting everything working. Rosie has got the link. I'm going to send her a message. Here's the link. She already had it, but just in case. Okay. How is everybody tonight? Hi, Lavender. How are you? How are you? We have Adriel Ross and Lavender Flower. We're waiting for Little Rosie. Hi, you made it on.
I did. I'm sorry. It took me a minute. I had gotten Google Hangouts, but I had not actually gone in and set it up. So I just now set it up, but I got it to work.
That's okay. I think you did it pretty quick if you just set it up. I wasn't waiting long at all.
Okay, good. I'm glad it worked.
Oh, yeah. Yeah, good. You did better than I did the first time. I was like really struggling. I just
Well, it's not me, it's the phone. The phone makes it really easy. Fortunately, I have like dummy technology, so it does it for me.
I do too. I do too. I have a hard. Oh, I have a follower request, but I want to go ahead and accept it in case it was one of your friends that wants the link to see everything. So, okay. So I just let them on. How are you tonight? How are you feeling, Rosie?
I'm doing okay. I'm a little tired, but that's just kind of what's normal right now with just starting back on chemo, and my sleep schedule's a little bit off. But other than that, I'm feeling okay.
Good. You look good.
Thank you.
So that's good to hear that you're taking chemo right now. You're good. That's important because you have to feel good for that next treatment, you know?
Yeah. Fortunately, the cycle that I'm on right now is he's calling it a consolidation cycle. This is my first coming back onto chemo after stem cell transplant. So I'm doing 2 weeks on and 1 week off. And hopefully, when I finish this consolidation cycle, um, it'll be a less amount. I won't be going as frequently.
Yeah. I just, hold on 1 second. Just a second, Lavender. Hold on, just made.
Oh, thank you, Lavender. I'm sorry, I'm just now getting the chat pulled up, guys, but thank you very much.
We're all getting adjusted. Just a second. Let's see. Oh, type something, Lavender. There you are. Okay. There you are, Lavender. You're blue. Okay. And type something in the chat, Rosie. Little Rosie, and let's see if you're blue. You could see that the
Yep, I'm blue.
okay. Oh, okay. So I'm showing no wrenches near your guys' name, but it'll catch up. So, okay, we got Lavender Flower, Little Rosie, thank you so much. Hi, Positive Bluebird. We have Little Rosie on panel. She's currently in treatment, and she has stage 3 multiple myeloma, which she's described as a bone and blood cancer. Am I correct, Little Rosie?
Yeah, it's actually a pretty rare cancer. And especially for me, typically multiple myeloma affects older African American males. And lately they've seen a rise in the number of younger Caucasian females that are affected with multiple myeloma. So this is something that, any questions that anybody has, I would love to answer. I'm not terribly knowledgeable about it, but much more. I'd never even heard of it before I was diagnosed. So,
Wow. How did you find out? Were you suspicious? Were you sick? Did you find it yourself? How did this come about?
it's kind of a long story, but I'm going to try to keep it really short. um, Last September, I had started just not feeling well. I was having a lot of pain in my lower back, my ribs, my shoulder. This pain would kind of move around. And I was seeing a doctor at the time, and I was going to her and telling her about this pain, and she wouldn't do anything. She wouldn't give me blood work. She wouldn't give me x-rays, nothing. And I kept going back, and I was like, please just help me find out what is wrong, what is causing this. Nothing. And then from October to December, I lost about 30 pounds without trying to. No, I was not trying at all. And I kept going back to this doctor, and I was like, something is going on. Can you please just do blood work, x-rays, anything, something to find out what this is? And she flat out told me I was med seeking and that she had no intentions of treating me or doing any kind of diagnostics. All she wanted to do was give me a referral to the pain clinic. So I've had SVT my whole life, supraventricular tachycardia. It's a rapid heart rate that just came and went. It was never really a problem, but in January it did get out of control, and I ended up admitted to the ICU for 3 days. And while I was in there, they went ahead and scheduled me for a catheter ablation to get the SVT under control. And during this time, I also knew that I needed to find a new primary doctor because I knew something was going on, something wasn't right, and she wasn't going to help me. So the day of my heart surgery, they took blood, and they noticed I had a really high calcium level in my blood. So they sent this lab work back to my new primary doctor, who I'd only been seeing for a week. So I came home after the heart surgery. Within 1 week after the heart surgery, I could not walk. I could not get myself up out of the bed. I could not get myself up off of the toilet when I went to the bathroom. I was rapidly declining. And so I went back to my primary care doctor, and he looked at the blood work and, asked me again about my symptoms. I told him where all the pain was and everything. So the very next morning, he sent me for a CT scan. And at 3 o'clock that afternoon, he called me and asked me to come back in. And really, the only thing he said, the only thing I know to tell you is that you have cancer, but I'm not sure exactly what it is, but you have holes in every bone in your body. And at that time, he immediately, before I even left the office, scheduled me with an oncologist for the next day. And the next day I was admitted to St. Joseph's Hospital in Asheville, North Carolina. And fortunately, the most amazing oncologist, and just happens to be a multiple myeloma specialist ever, was on call at the hospital that weekend. He came in, got straight on he stayed at the hospital with me all weekend and did the biopsies, all the blood work, all the tests that needed to be done, and confirmed that weekend that it was stage 3 multiple myeloma.
Wow.
And it's to me, it's unfortunate because I feel like if it's something that had been caught earlier when I first started having the symptoms, that maybe we could have caught it at an earlier stage, and possibly, it would not, definitely not have been as advanced as what it is. But, where I live, there is an opioid problem. There are a lot of people here who have narcotics addictions, and unfortunately, some of us who are actually struggling with an illness don't get the medical care that we need because of it.
Oh, that breaks my heart. So I'm I have my volume up pretty loud. I don't know how loud I'm coming across, but I'm struggling to hear you. So you went to the doctor, you were explaining that you had some pain and they were kind of like just pushing you to the side because you think they were just thinking maybe you were wanting pain medications?
Yes, yes. The doctor that I was seeing at first just flat out made the statement to me that I was just med seeking, that I was just looking for narcotics.
Oh my goodness. That see that's why I really that's one of the reasons why I feel strongly about being a cancer patient advocate because one of the ladies that she was in her 70s and I was giving her rides and she was having trouble just getting anxiety medications and I'm like, "Really?" So once I started going in and sitting in the doctor's office with her in the actual exam room and taking notes with a notebook, he decided that the doctor decided, her oncologist decided that I better give her anxiety medications. But he was hesitant to even give her that because um, he didn't think she had anybody looking after her. And once she brought somebody in the room with her, the doctor straightened up a little bit.
Yeah. Yeah, well, the laws that they have now, I mean, there's definitely a need for them, but it seems like it's affecting all the wrong people. It's not. I don't think that the opioid laws and the narcotic laws are doing what they were intended to do, and they're having negative effects on real suffering patients.
Absolutely, I agree with you. Absolutely.
And they've got the doctors scared to death, which, unfortunately, I believe that maybe the laws are a little bit different for oncologists. Maybe, I don't know. Don't, hold me to that. But I know that, like just primary care doctors and things like that, they are very, very careful and very strict. And with my oncologist, I mean, of course, he knows what I'm prescribed, what day of the month I'm prescribed it. He knows what my counts are and everything. He's very responsible, but he's always, made sure that my pain is well managed. So I think maybe they're a little bit more lenient with cancer patients.
Well, yeah, an oncologist, they do have, um, well, I think all doctors have the same paperwork they have to fill out, the way I understand it, because my good friend is an onc nurse. But they're questioned a little less because of their field of medicine. Um, most of their patients are expected to have pain because
Yeah,
cancer pain is one of the types of pain that, isn't questioned.
right.
There are a lot of chronic diseases and illnesses out there that I believe are equally as painful. But those people suffer greatly and dearly because of these new laws, because they can't get, certain medications. And I feel for, I feel for the families of the people who have died because of opiates. But there are people who are seriously, legitimately in need of pain medications and they're being denied. So who's really winning here? I mean, how is this a winning? How it just doesn't seem, the math isn't right in my head. I can't fathom that you're going to put these strict laws, make people with disability on very little income have to go up to the pharmacy 3 times, 4 times, 5 times more than they ever had to, go to the doctor's office, so many times more than they were used to. And, when I get asked to give rides and stuff, it's hard because it's getting to the point where I can't, do this on my own finances, and, but to expect this out of people who are struggling financially because, one, they can't work because they've become sick. I mean, when I was diagnosed and I had my surgeries back to back, I had chemo, I had radiation, I couldn't work during that time.
No, there's no way.
Right. So were you working when all this happened, or were you, not that it matters, but I mean,
I
um,
was. I've been a worker my whole life. We're common people. We live paycheck to paycheck. So I was working right up until um, just maybe a week or two before I had the heart surgery. And the only reason I stopped working then was because my heart just kept going out of rhythm, and I was getting very lightheaded, and it was getting kind of dangerous for me to be doing the job that I was doing. So I actually went out of work because of my heart rhythm before I even knew that I had cancer. But then, of course, 1 week after the surgery, I got my cancer diagnosis, and the oncologist that I saw, he immediately started my disability paperwork.
yeah, yeah, I had that's where I really bonded with my aunt nurse because she just dived right in there. I didn't understand anything, and then the chemo brain got me, and it got me right away. And so she helped me and that, with paperwork and stuff. I was so, I don't know how you took the news, but I walked out of my doctor's office I was so shocked, and I was so stunned. It felt like I was just so stunned. There was nothing else. I was numb. I just walked to my car and I was numb. And I thought, now my husband's at work, everybody's at work, my whole family's at work. What do I do? I was told at 2:30 in the afternoon, and I thought, wow, do I call everybody? Do I wait? Do I sit in this with this information for 3 or 4 hours, or what do I do? And I just came home. I sat on the couch, and all I did was cry. That's all I could think I could do. I had to release it. What?
I was fortunate that when the doctor called me to come in, he didn't give me any, but he told me to bring my husband with me. And my husband was at work, so I called him. I called my mom and asked her to give me a ride to the doctor's office. And I told my husband he needed to leave work and meet me at the doctor's office. So I was not alone when I was told, but I did immediately go into shock. I was just kind of quiet. My husband panicked, and I was like, sit down, that's not going to do any good. But I was in shock for the first couple of days. I was just really quiet. I think my first clear thought about it was that that God must have some kind of purpose for this, and I prayed for God to lead me to do what His will was for me with this, and then that's when I opened up to everybody, all of my friends and family, about everything that was going on. And at first, I did not know if I was going to take treatment or not. When I realized that I was stage 3, and stage 3 is the highest stage for multiple myeloma. It doesn't go to stage 4.
Okay.
And I was looking at the statistics, the survival rates and things for stage 3, and I wasn't sure if I wanted to take treatment. But my doctor, he talked to me and he said, look, you're young. It's advanced, it's aggressive, but you're young, and I can't let you not try. And fortunately, treatment has been very effective. I've responded really well. So I'm glad that I made the choice to take treatment.
Oh, that's wonderful. Did they give you did they offer you any kind of gene test to see if your treatment would respond to your tumor?
Now, the way that they treat multiple myeloma is they start with the treatment that has been most effective for the majority of multiple myeloma patients. And it's a cocktail treatment of RVD. It's Revlimid, Velcade, and dexamethasone, which is a chemotherapy pill, a chemotherapy injection, and steroids. And also Zometa infusions, which is a bone strengthener.
Absolutely, I had that.
Yeah, and that can be very, very painful if it's not given a certain way.
I am so glad. Sorry to interrupt you, but I am so glad to hear you say that, because I have been told that there's no way that the IV Zometa would do that to you, but I was crumpled up, almost crippled. I couldn't get out of bed. I could, but I was hunched over like a little old lady. It hurt so bad. My bones hurt so bad.
I had my first Zometa infusion actually in the hospital, and they kept me so sedated that the weekend that I was in the hospital that I didn't have any pain from that one. But the first Zometa infusion that I had at treatment center for 3 days, I just fought it. I literally thought I was dying. At that time, I was under palliative care. I'm actually back under palliative care now, but that's another story. But so I thought I was dying because of the pain, and I called palliative care nurse, and she came out and found out, that I just had the Zometa infusion a few days before. She called my doctor. They got me some more pain meds on board, got me loaded up really well. But I can tell you that just on recommendation from palliative care nurses and from other patients who have taken the Zometa infusions, I now take a Claritin, every morning. I don't know what it is. They say they don't know what the link is, but they have found that Claritin can help reduce the amount of bone pain after a Zometa infusion. And I did ask them to, they were running my infusion over a period of like 45 minutes. And I
Mm-hmm.
asked them to slow it down and extend it to like an hour and a half and add me a bag of just regular IV fluids with it.
Mm-hmm.
And between slowing it down and adding the fluids and taking a Claritin every day, it cut out that bone pain after the Zometa infusion.
Thank you
So,
for that, because I'm gonna jot this down, because the Zometa and then the tamoxifen is what put me in remission, and I'm hoping that's all I'm gonna need. And they would give me, with the Zometa, you said they gave you Claritin, they would give me a Benadryl bag. I would have an IV of Benadryl, and then of course, they would give me, I don't know, they would just shoot in um, well, not the IV, but in my pickling port,
yes.
um, they would shoot a steroid.
Mm-hmm.
So, but I'm hoping that's all I have to have, and no other chemo. But wow. See, this is what helps survivors talk to survivors, because you're the only one that I know that has had that other treatment, the Zometa. I haven't met another cancer patient that I've talked to. Now, I know that a lot of cancer patients receive this. I know it's being prescribed off label. That's what I was told. I understand the studies about it that they did over in Germany. It was explained to me how the cancer can sit in the bone marrow and then resurface and back into the bloodstream. And this is Germany's advancements in cancer technology. So I've been told. Now, I'm sure somebody's going to come across this video and correct me or send me messages, but that's what I was told, and that was my understanding. But you are the first one that I've met that I could actually relate and ask questions and know that somebody else was given that treatment off label.
Yeah, you're the first person that I've, which I'm sure there are probably other people at the treatment center where I go who get it, but I don't sit down and talk to them. I don't have conversations with them. So you're the first other cancer patient that I've talked to about Zometa.
Yeah, it's you know, in our chemo room, I don't know how yours is set up, but it's not a very big room, and we have the recliners on both sides, up against the wall. And so we kind of face each other.
Yeah.
But I noticed in your picture on your Twitter, you were sitting in the chemo recliner up, you got the corner one near the wall. I would always pick the one near the wall too. That way, if somebody dozed off and started leaning, they wouldn't lay on me. And then, too, if somebody got sick, I would only get it from one side.
Now, where I was at that day was actually just a small injection room,
Mm-hmm.
because the only time I have to sit like out where the rows of the big recliners are is when I'm getting a Zometa infusion. And other than that, Velcade is just an injection that I get into my abdomen. So on the days that I go just for a Velcade injection, I'm in and out in less than 20 minutes. I just go into the injection room, they pop it in my belly, and I'm good to go. So that's just one little private room, and then I'm out.
Yeah. So in your video, it shows, or you're saying that you're going up the hill for treatment. Do you have to do that every time you need treatment? You have to go, do you have quite a drive?
It's about a 30 to 40 minute drive. It's not that bad. I live in the like foothills of the Appalachian Mountains in North Carolina. So where I drive up a mountain to actually up into the mountains there in Asheville, North Carolina. But it's a beautiful drive, and it's not bad. But I do that right now. I'm doing that twice a week for the injections.
Yeah, that's wonderful. Yeah, I give rides anywhere from, just 20 miles to over like actually about 60 miles one way. Well, I think it's what, yeah, about 55 miles one way. Um, and so, it's really a blessing to be able to, have the transportation to at least get there. I've met people who can't even, um, they have a hard time. They can't even find rides and stuff. But that was now there's the Uber service. There's a lot more apps out there for ride dependent people. And so that warms my heart to know that at least people could find rides, if they have a means to pay for it.
Yes, yes. And but that's something too that DSS, as far as I know, I believe that for anyone who has Medicaid, they also have a right to travel expenses, like financial compensation for either gas money or to pay for a cab or Uber or whatever they need. And I don't think a lot of the people around here are being told that they have the right to that benefit. I don't think that that benefit's being offered to them.
The only problem with that, we have that here, but the only problem with that is they have to find somebody like me to front them the rides, because they're given a form to fill out, and then they usually hand it to me or whatever, and I put in the mileage or whatever and initial it, and then they get a check in the mail for some, it's like a mileage log, and so
Okay.
they'll get that money, but it's pennies, so it's really difficult. Um, and they get it later. They have to, they have to fill out the whole page before they could mail it in. So that's X amount of trips before they could ever get any kind of reimbursement. So, but they do. You're right, they do, but they get it like later after the fact. When you got to go to treatment, you can't. You have to go on the doctor's schedule, not who's going to provide you gas monies, their schedule. So that's what makes it hard. Um, and I created a PayPal, on my YouTube. I'm willing to make videos and do this channel and, put the PayPal out there so I could help, continue to help, give rides and do what I do. But, there's been a lot of scammers on YouTube, so there's people who just really are reluctant right now to help. But it's okay. Um, you know, people in our community, I'm willing to help, and I encourage other people to help. So everybody finds a way. Um, I'm glad to see that that isn't a hardship for you right now. Um, I hope that everything goes. When I saw your video, I just really related to what you're going through, because you've got to understand all this paperwork and get it filled out. I hope everything works out for you. And if it doesn't, I hope that you reach out to me and I can at least have the opportunity to see what I could do if something happens.
Thank you so much. I actually have some good news. The social worker from palliative care did come today and meet with me here, and she went ahead and put me back on palliative care services, just because I am having such a struggle with readjusting to chemo and everything right now. And she did go ahead. She's gonna start the paperwork to help me with DSS and with my Medicaid. She looked over my paperwork that they've been sending to me and my Social Security paperwork, and she knows that with my chemo brain, I'm just struggling with the comprehending and You know, like I said, I've never actually been able to meet one of my caseworkers face to face. So she's going to help me with that. She's going to schedule an appointment and take care of this for me. So I'm very grateful for that.
Good. I'm glad. I'm glad. We just got to take it one day at a time, you know, and do the best we can to support each other and help each other. You know, like you said, we're cancer sisters, and that's true. We got to help each other. And
Yeah.
so what? So how many treatments have you? You know, you don't have to. You could talk about whatever you like if you feel more comfortable me asking questions. And whatever you do, just always remember that this is YouTube. I'm new, you're new, and I'm getting the feeling that we should be very careful about what personal information and what, you know, how deep we
Yeah.
go into sharing, because I'm seeing a lot and I'm not exactly pleased with what I'm seeing. So if I ask a question and you don't want to answer it, I will not be offended whatsoever. But I just, you know, looking for conversation and to make this a video that somebody else could look at. Because it's not only our YouTube community that watches these. I'm seeing a lot of people outside the YouTube community that you and I know watching these videos in my analytics. So I know that they're reaching people who are clicking on that cancer search button. So we are making a difference by making these, and we are reaching the people who need to hear our stories. There is no doubt in my mind about that. And so I'm trying, I'm trying to be, learn to trust, but I'm also seeing stuff that is making me get real nervous and, pique my anxiety. And so I just, I don't have a whole lot of advice because I'm new too, but I would just be careful what you share. And, if you don't want to answer anything, just say, let's go on to the next one, the next question or whatever. But so I was going to ask you, do you have a lot more treatments? Are you going to be taking treatments for a while, or are you almost done?
Well, I will be on treatment for the rest of my life. Once I complete this consolidation therapy, I will go to maintenance chemo. And the way that the pattern is with multiple myeloma, um, you'll be on a treatment for a while, and a treatment may work for months, it may work for years, but then it's almost like an infection that becomes antibiotic resistant, and the treatment starts working and the cancer is progressing again. And when that starts showing up, and then they try another treatment, and you have to do that until you find a treatment that starts working for you again and getting those numbers back down to manageable maintenance numbers. And so it's just kind of, I'll be on treatment for the rest of my life.
Yeah. There was a girl that always took I always took like I said earlier, the corner recliner. And there was a 23-year-old, beautiful, beautiful young girl that took the corner one across from me. So we would be face to face, and our poles would be, your pole that they hang your IV, your treatments on. Our poles would be, facing each other, and we would be face to face. And I noticed she was like, really young. And I asked her age, and she told me she was 23. And we started talking a little bit, and come to find out she had colon cancer. And she said that she had to do a once a week maintenance for the rest of her life. I just about fell off of the chair there. I thought, my goodness, age 23 years old, and you're going to be in here once a month for the rest of your life.
It can be devastating, but at the same time, you can find strength in the places that you never thought you would. You can find some kind of strength from others around you and from inside you that you never knew you had. And don't get me wrong, it's not all the time. I'm certainly not strong all the time. I have my days when I don't want to do it anymore, but you push through.
I agree. One of my favorite memes I would see on social media was, what was it? The quote, oh gosh, I can't even, it always happens to me. Something about being strong. You can be strong when being strong is the only choice you have. I don't know if you saw that, Mimi. I know I'm saying it wrong, but
I know the one you're talking. I think it's you don't know how strong you can
yeah.
be until being strong is the only choice you have. Something like that. But
Yes,
yeah, I love
yes,
that.
yes. That's it. You don't know. Yes, you don't know how strong you are until being strong is the only choice you have. Absolutely, yeah. That's it. That comes to mind because we weren't given a choice. And I was thinking about earlier today when I was eating dinner, you know, contemplating having you on and thinking, you know, okay, what are we going to talk about? And, you know, what I should ask you and all this. And I was talking to my husband while we were eating dinner, and, you know, we're not given a choice. You know, people that are on death row, I mean, they're told the date that they're going to get their lethal injection, and they have the hope that they're going to get a stay of execution, you know, that some governor is going to call that red phone in the prison and say, okay, we're going to change that date. But we don't get that. When we're told we have cancer, and then, you know, these are the treatments, and we're told by our doctor that we don't have a guarantee that these will even work, you know, all this stuff goes through our minds, and there's no rescue phone for us, you know. It's hard. It's really hard to think about on a daily basis. And I mean, I don't dwell on it and I don't think about it every day, but it does worry me. How do you cope and how do you deal with that? How do you deal with that? Do you have thoughts like that? Or do you just, how do you deal with that?
I do, and I have had thoughts that have gone like from one extreme to the other of being completely depressed of knowing that this was, you know, unless there's some kind of tragic accident, most likely this is what I will die from. And then, you know, to thoughts of extreme positivity of, you know, they're working on new treatments every day. There may be a cure just around the corner. And so I've had extreme thoughts in both directions. And I've found that really the best thing for me for my mental health is just to try to stay in that middle lane of focusing on just today. I've got today. And right now, this is working and I'm doing well. And when it's not working, we'll try something else. And, you know, I try just to not let my thoughts go to the extremes of either direction and just stay in the middle lane.
Yep, that's what I do. I just, when I start to go, you know, a little too far to the left, I bring myself a little further right until I'm in that middle way. Yep. And then when I go off the other direction to the, you know, too far the other way, I pull myself back and get back in that middle lane. Yep. I do the same thing. It's, and it's something that never leaves you, even though, you have years. I'm 8 years out of treatment, didn't quite make it to 5, and now reoccurrence, and I'm don't know where I'm at just yet. If I'm going to be back in treatment or not. I'm still waiting those results and stuff, and what they're going to say. But a lot's going through my mind right now, and I just don't want to do it again. Is this your first time, or is this is this more, is this your second time through or your first time through?
I was diagnosed in March of last year, 2017, and we started treatment right away, immediately. And I was in chemo from March until August. And then I had to stop chemo in order to go for stem cell transplant, because the transplant and that treatment required a different medication, a different chemotherapy. And so I was out of chemo, not on chemo, from the time of transplant until just before Christmas. They like to, what they do is at about 90 days to 100 days post transplant, they do, the extensive blood work, the multiple myeloma panel, a new bone marrow biopsy, and they look at those numbers and decide what treatment to go with at that time based on those results.
Yeah. What is a stem cell transplant like?
It was the hardest thing I have ever been through. The process itself sounds a lot more complicated than it actually is. Before transplant, for about 4 days, I took human growth hormone injections to boost stem cell production. And then they gave me a trifusion catheter, and I went for stem cell collection. And the way that works is it's a big machine, and it works a lot like kidney dialysis, but your blood comes out one of the catheters and goes through this machine, and it spins. And somehow, through miracle technology, the rate that it spins at and the weight of stem cells, it separates out your stem cells from all your other blood cells. And the stem cells go into a bag, and the rest of your blood goes back into you. And our goal was to collect 10 million stem cells over a period of 3 to 4 days. And by the grace of God, because I just knew I could not do it another day, after the first day, I collected 11.5 million stem cells on the first day. After that, they give you like a week to recover from collection. That you just get to rest. And then you go in, and they give you high dose melphalan chemotherapy. It goes over a period of about an hour, and this is a level and a medication that is high enough to kill everything, not only the cancer cells, but your red blood cells, white blood cells, your neutrophils, everything. So it's also called a rescue transplant, because what they do is, after they give you that high dose melphalan chemo, 24 hours later, they give you your stem cells back. Not all of them. I think I got 4.5 million back. And the goal of that is to kill off as many of the cancer cells as possible, with the hopes that the stem cells that you get back will replace everything with healthy, non-cancerous cells. And it was very effective for me.
I saw, gosh, I don't know if it was a documentary or another movie, and I might have seen both. Oh, I'm trying to think of what it was on. Anyway, I saw a program on TV about that, and that is it's absolute remarkable technology. And they collected a bag of the cells, and then they multiplied them in the laboratory or something.
Mm-hmm.
They multiplied these cells. They collected so much for, this in this particular situation. Oh, I think it was a gal that had, it was a blood cancer for sure. I know that. But they had collected a bunch, and then they multiplied them, and then they put them back in her body. And she actually literally walked out of there, and beat her cancer. And
Yeah.
I think the program showcased 3 different people, and out of all 3, she's the one who made it.
That it's the research and treatments that they are coming up with is leaps and bounds. I really believe that there are good research foundations that are doing really good work and are trying everything possible to cure people. And there are so many different kinds of cancer that one treatment will work for one thing but not something else, and so it's a race. They're always running to try to keep up with cancer, and it's constantly evolving. But I really believe that they are doing some very good work in treatment research.
Yeah. Yeah. Yeah, they are. The rates, the rates are getting a lot better for breast cancer, or not the rates. It's still 1 in 8 will be diagnosed with breast cancer, but they are, the success rates and the deaths are lowering from certain types of breast cancer. And they're doing really good with, the prostate cancers. I have a lot of hope, but I choose to hang on to hope versus, the other, because I don't want to think that way at all. I want to stay positive.
Right.
You know,
I
want
want
to.
to answer Lavender really quickly if I can. I
Oh
know I don't have.
yes, definitely interact with the chat a minute.
I don't have any problem answering it. Yeah, I do have children. I have 2 boys. My oldest son is 22. He's an adult, and my youngest son is actually 15. So I do have 2 boys. Oh, and then it got quiet. Oh, I did want to touch on what we were discussing earlier about the negative things that we've seen happening on YouTube, especially with cancer. It's I was looking around on YouTube for quite a while before I even decided that I wanted to consider making videos, and I saw all this stuff going on, and so I was really skeptical about it. And I wanted to do this for 2 different reasons. To leave behind videos for my family for after I'm gone, and also to reach out to be a part of a community, to be supported and supportive in return, because it's very important to have a network, a support network. And so you don't always have that locally. I live in a small town. I think currently I'm the youngest cancer patient in this town right now. And so sometimes you have to, reach out outside of locally to have a support system. And I reached out to, just a couple of people, and said, well, what do you think about this? And I got support and encouragement. And I finally just had to, put my faith in it, that the reasons that I wanted to do this were more important than any kind of negative backlash that might come on me. And, the scammers and the fakers, that's going to be ugly when that comes back to them. And, but I can't hold other people responsible or hold them at fault for being skeptical, because I have seen everything that's going on. But I'm hoping that among the real cancer community, or among the real cancer patients, I'm hoping that we are positive enough and are supportive enough to turn that perspective around and to get that faith restored, to build a positive community.
I agree with you 100%, and that's why I'm doing this. And I applaud you for coming on. You didn't know how, and you were willing. The thing about it is, yeah, people in the particular community that we've decided to, join in on their live streams, they had just experienced somebody, a fraud. And so, yeah, they are skeptical, and I don't blame them either. But I myself, I didn't have a Facebook when I was diagnosed. I didn't have anything like that. And my oncology nurse suggested to all of us, she said, well, there was a free website if you were a cancer patient, and that way you could go on, you could add friends like Facebook, and you could tell everybody what was going on with you all at once instead of making that individual phone call to everybody. Because what happens is when you start calling everybody, like your sisters, your brother, and all this, you start crying, and this way you could just type in what's going on, and you didn't have to relive it each time you told somebody, and made that phone call. And but the problem with that particular website, and I don't even know the name of it now because it's, like I said, it's been 8 years. They heavily looked for donations, and they had commercials or whatever. They had interruptions, and they heavily asked your family for donations. And I didn't like that about that particular website. And it was for, people with illnesses. It was specifically for that. And then somebody said, hey, why don't you just create a Facebook and only have your family on it, and then do it that way? So that's what I did, because that other Facebook also wanted a minimum monthly fee. And so that was how I found Facebook, was through my oncology nurse. And so that's what I did. And then that's what I do to, I just have my family. And then, when something happens, I let them all know. And then when, I get results back, I let them know, that way I don't have to make individual phone calls. But what I have found is, for me, that was one of the things that my oncology nurse suggested, was to build just what you just got done saying, is build a network of support. Because having a support system in treatment, the doctor's looking for everything. He's looking for mental, physical, and spiritual. And I'm not talking religion. I'm talking about just mental and spiritual strength. And spiritual could just mean hope. Hope is a spiritual principle. To have hope is, everybody thinks that's a feeling. No, feelings are happy, sad, angry. Those are feelings. Hope is a spiritual principle, and at least in my belief system. And in having a good, healthy body, and, a spiritually strong attitude and mind helps, it also lets our doctor know where we're at when it's time for that next treatment. I've actually seen my doctor literally turn patients away that he felt just couldn't take anymore. He wasn't gonna give them treatment if they, one, weren't up for it. Have you seen any of that or heard about anything like that?
I have not seen a doctor actually turn anyone away, but I I have seen a case of the doctor being just very bluntly honest about we can do this treatment if you want us to, but the chances of it helping are slim to none, and it would cause you more pain and more side effects. And that kind of honesty I appreciate that, because I would not want to put myself through something like that if it was not gonna work. So I've seen just blunt honesty.
I think maybe yeah, I'll retract that and say that's exactly a better way to put it, blunt on honesty. I've heard it from the next exam room. And
Yeah.
in my mind, I think I want to say that's turning somebody away, but I guess you're explaining it a lot better than I'm not good with words at all, little Rosie. I'm not, and I'm not good at expressing myself. Um, so that
I
is a
think
bit.
you're great. I really do. I'm really enjoying our conversation. I'm really enjoying this because I'm having an easy time talking to you. And I wanted to say really quickly, about Facebook. I've said in my first video, Little Rosie is not my real name. But that's my name on YouTube and that's my name on Twitter. And because I've chosen YouTube and Twitter as my social media to reach out to the cancer community. Now, my Facebook, of course, is my actual friends and family. And of course, I, keep them updated on what's going on with me and everything, and other aspects of my personal life, because those are people that I personally know. But as far as what I'm doing on YouTube and Twitter, most of the people in my real life do not even know about it. And the reason why is because my friends and family are a great support group. They really are. But it is not the same as being able to talk to other cancer patients. No matter, I know that they're going through this with me. I know that for a lot of the part, them having to watch me go through this is harder than me going through it. I can understand that. But they cannot understand what it's like to be the patient. And I needed that kind of support. I needed that kind of connection and communication. And that's why I'm kind of keeping what I'm doing with reaching out to the cancer community separate from my personal life, because they're just two separate needs for me.
I agree 100%. The two ladies that I lost in 2017, we were like that. It just, we would go have a coffee, or we would just do our grocery shopping together or whatever, but we would just hang out together because it just, when we went back home, we felt like we could face our families without burdening them. As one of the ladies put it to me, we were members of a certain club, and when we were together, we didn't even have to speak about it. We just could look at one another and we knew, you know, how each other was feeling. Um, and then we could go back home and not have to say anything, because we don't want to burden. Well, we know we're not a burden to our loved ones, but we know our loved ones are worried sick about us, and we don't want them to be.
Yeah, and I mean, my husband is sitting here right now, and I'm going to say this in front of him, but there are thoughts and feelings that I have that I don't want to say to him, that I don't want to say in front of him. And not just because, I feel like it would cause him more stress or sadness and things like that, but it's just something that he can't understand. And I don't want to burden him with something that he can't understand when I can reach out to a cancer sister, a cancer community, and have, open discussion with people who understand. And there are just things I don't want to say to my family, things that I feel and things that I think. I'm just not comfortable with saying it to them just because they can't understand.
Yeah. I totally get that. It's just until you've been there, and gosh, I hope nobody, I wish this on nobody in this chat, nobody on YouTube, nobody in the world. I do not wish cancer, just hearing the word, you freak out, you just, it starts causing all kinds of anxiety. But our loved ones are going through this with us. And my husband goes off to work and he comes back home. And if I've had, we have good days and we have bad days, and it's visible to them. They'll come in the door and we've been in bed half the day when that's not our MO. That's not what we normally do. Or say we just didn't feel like we could make it to, through cooking dinner. So we're laying there, or we're sitting in a chair, or we're out of breath, or whatever the case may be. And our loved one is looking over at us like, uh, and we're trying to say, oh, this will pass. It'll be okay. But they don't know, and they worry. They get worried sick. And I see the age over these last 8 years in my husband's eyes, and on his face. And some days when I'm having like a bad day, we call him, you're a cancer sister, so we call him, we have, what is it that we would always say to one another? We would call each other and say, are you having we wouldn't say a good day or a bad day, but we would say, are you up or are you down today? And that's all we would have to say is, this is a down day or an up day. And we did not have to explain any further. And one of us would take a meal over to the other one's house. I would take a meal over, especially the one that passed away in September. She had a daughter in middle school and a husband and a teenager. He was in what I think his second year of high school. And so she had these three depending on her. And so even if it was just sending over some pizza or taking, getting some Kentucky Fried Chicken or whatever it was, Popeye's chicken or whatever, and dropping it off because, we knew that she was struggling, and towards the end there, she was doing oral chemo and IV chemo, and she was doing just everything that she could, her little body could take. And she just struggled. But we could just see it, when we'd knock on the door, we'd bring flowers and we'd bring dinner. And
Yeah, and it is the little things like that that help you so much, not just physically, but mentally and emotionally too. Because like for me, especially when I first found out I was sick, I like to live in a clean house. I don't live anywhere fancy or anything like that, but I like for my home to be clean. It's just comfortable to me. And when I first got sick, I had no strength to clean my house, dusting, vacuuming, keeping the dishes done and the laundry done. And that was breaking my heart. It was tearing me down mentally because I was not used to living that way. And, my husband is still working full time. So he was working all day long and coming home and cleaning the house. And, my mom would come a couple of days a week. And don't get me wrong, I'm grateful for everything, but it's my house. If they're not cleaning it my way, it's not clean to me. And it's the little things like that, though, people helping out with housework and a meal and just the little things like that that do help out with your mental health so much. And I'm going through that again, a little bit again right now because just starting back on the chemo. I call it the chemo crud, where it's almost hard to tell when I'm feeling bad if it's the cancer or if it's side effect from the chemo. But I just, just being exhausted or getting in a bad mood or just not feeling well and not having the energy to do anything. But, I'm hoping that'll pass soon because it's good for my mental health when I'm able to get up and do more physically.
Absolutely. I'm the same way. If I could take care of my business, I feel at the end of the day accomplished. And if I feel accomplished, then I feel, just even if my body doesn't have any energy, I feel good about myself because I've taken care of, you know, my part in the family. And that's important to me. And it's apparent that it's important to you. And it is hard when we're down and we're having down days and then too we have to deal with the depression of just because we go through a grief process of losing our good health. And that's another thing that a lot of people don't understand. And even cancers, people battling cancer, they don't stop and actually realize, hey, wait a minute. I have to give myself a big break here. I'm grieving the loss of my good health. I have to say goodbye to the person I once was. I'll never be the same again. I'll never have that energy to go out there and garden or go out there and do this or go out there and do that. I mean, a lot of people give up their hobbies because their hobby took a lot of energy. I've talked to survivors that, they were real active in sports or, one gal I knew that was real active in soccer and had to give that up. And, they just don't have the energy anymore. And so I found that, even with myself, that I've had to be kind to myself and extra gentle on myself because I'm grieving the loss of my good health. And I'm not, even though I look okay. And Little Rosie, I got my hair back and I spend time on making myself look good. And so people look at me and they go, well, you don't look sick. Well, you're damn right. I'm making a damn good effort not to look sick.
Yes, and it is work. It is work to try to just to look healthy when you're fighting cancer and taking treatment. That it affects your whole body. It affects your skin, your teeth, your circulation, your complexion, all of that, and it really can take work to when we were before we were getting ready. I was like, I've got to go put on at least a little bit of makeup so I don't look like the Walking Dead in here. But you are so exactly right about grieving the loss. For me, it was actually a long time before I actually fully realized that I was never going to work again. Um, and I realized that, even though a lot of the aspects of my life are still the same, I still live in the same home. My family is still, a lot of things haven't changed. But there are several large aspects of my life that have changed and will never be the same again. And I am still in the process of grieving that loss. I'm still not okay with everything that has been taken from me yet. And that's something that I'm just going to have to work through, because like I said, I've put my faith in God that there is a reason for this, there is a purpose. He has some job for me to do through this, and I pray for him to lead me in his way, to do his will through this. And so that's something that I'm going to have to work through, to be okay with letting go of what is gone and fully accepting what life is now. And I'll get there. I will. And I believe that, what I'm doing here with you and this community is going to be a big part of it. I think that this is going to be a huge help to me with that process.
You want to address Lavender
Uh,
in the chat?
I have never had anybody say to me that I look sick, even on my worst days. And I think it was just because people were being kind. Nobody is, even on days I knew I looked terrible, people would tell me, you look like $1,000,000. And that would make me mad, because I don't feel like $1,000,000 and I don't care how I look. And one of the other things that would upset me is, of course, I get handicapped parking. My bones are destroyed. I have recurring spinal fractures. So, I can't walk long distances without a lot of pain. And before, the regular chemotherapy that I take does not make my hair fall out. The melphalan that I had during stem cell is what made my hair fall out. So before stem cell transplant, I didn't look very sick. And we would park in the handicapped spot, and I would, get out and walk into Walmart. And people were just giving me this look like I was the lowest scum on earth, because they couldn't see what was inside. But nobody's ever actually said anything to me.
Oh, I would like to address that. I had an experience where I parked in a handicapped with my handicap sign, and I didn't look sick. And a person took a basket and pushed it into the side of my car and dented my car.
People, I don't. It's the
I
world we're
couldn't.
living in today. I don't understand it. There's people are so desensitized to everything, and they're so quick to pass judgment. And I'm just as guilty. That's something I'm still learning too. People are so quick to pass judgment without knowing what's really going on. And, that's something I need to work on too. But we're all going to have to work on that. We're destroying our own selves from within with the way we treat each other. And it's not good for us. It's not good. And Lavender, I wanted to say, you know, I do understand what you're saying about that. That really hurt, because she was your sister. I can't imagine that. I have a brother, an older brother, and he and I are close. We actually don't see each other or speak very often. But if I were to call him at 3 o'clock in the morning, he'd be right here for me. But he has never made any comments on my cancer, because I just don't think he knows what to say. He tells me that he loves me, and if there's anything that I need, to let him know. But I honestly think a lot of times our family members and our loved one, they just don't know what to say. My stepdad had lung cancer, and I can remember, as being his daughter, there were times when I looked at him and I just did not know what to say. And a lot of times I just wouldn't say anything because nothing that I was thinking felt right to say out loud. I didn't know how it would make him feel. Um, and so, like I said, they're going through this with us, but from the complete opposite end of the spectrum. We get up every day and do whatever we can to fight, and they feel so helpless. And certainly I don't know the relationship between you and your sister, so I'm not passing any kind of judgment on anything like that. I'm just saying that we don't ever know how they're dealing with our illness. And I think a lot of times it's just hard for them to know what to say to us.
I agree. I totally agree with you. How are you dealing with, are you having side effects? Are there side effects to the stem cell transplant?
All of the side effects that I had from the stem cell transplant were within just the first few months after that. And I was very, very sick throughout the first month from the chemo, and then just very weak and tired. It took me a very long time to get my strength back and my energy back. And now, where I have started back on my regular, like treatment, chemo, I was just having a lot of the same side effects that I had the first time. Like right now, the inside of my mouth is just scalded fried. I hate that. Nothing tastes right. The steroids have got my sleeping off. I want to stay up all night and sleep in the mornings. Um, Occasionally I have blurry vision. It's just, things that come and go, and none of it is terribly debilitating. Just more than anything, it's just frustrating. But the first time I went through it, my body did, finally start adjusting to it, and the side effects weren't as bad. So I'm hoping that that's what will happen this time too.
Yeah. Some of the, just to name a few, I mean, I have so many side effects. I mean, it would just be a notebook full. But neuropathy, did you end up with neuropathy? Do you get numbness in your hands and pins and needles in your hands and your feet? And, do you
I
taste?
did.
Do you
Yeah.
lose your appetite randomly? Do you taste metal in your mouth? I go through all of that stuff, and then I mean, I could write a book on just my side effects from chemo. But one of the thing is I just don't want to. I don't want to go too. I'm not saying for you to, but I mean, I don't want myself to dwell too much on. I don't want to discourage anyone from not taking treatment. That's not the message I want to put out there, because I think taking treatment is a very important decision, and it's a personal decision between you, your family, and your doctor. I decided to take treatment, and I'm very glad and grateful that it was available to me, and I did take it. I believe I'm here today because I took treatment, so I have no regrets. But there are things that we deal with on a day-to-day basis that don't seem to go away. Are you experiencing those kinds of things?
I am, and but it's like the side effects, they change, and they come and go, and um like I said, once I finish consolidation therapy and go to maintenance care therapy, it's going to be less frequent and lower doses. So I'm hoping that I'll have drastically less side effects. But the worst one for me is the chemo brain, because I have always been a very well organized, well spoken. I had clear thought processes. And the struggle with that, with the forgetfulness and word processing, not being able to find the right words when I'm trying to talk, or if somebody says something to me and I heard every word that they said clearly, I just couldn't put the words together to make a complete thought and understand a complete thought. And that's very frustrating. That's very painful to me because, physically we can deal with things. There are ways to deal with the physical aspects of this, but when it affects my mental status, and that's painful to me because that's something that is hard to fight. It's just really hard to fight chemo brain.
It is. It truly is. And the anxiety. And I'm sure you were probably watching the other day when I was, my channel was being, I don't know if you were in that live stream, or maybe you've been in some live streams that I've been in, or if I was on panel. I have a hard time sometimes, with my cognitive, my brain and finding the words and everything connecting. And I even will be in conversation with my husband, and I'm a professional person, and, I've always had a job. I've worked, since I was like, my first job was like, I think I was 13 years old. I've been working since 13 on a work permit, but, I'll even pronounce words wrong. I'll transpose numbers sometimes, and I have to talk slower than I used to, and I have to take my time. But I also ended up having a brain bleed, and I had, a craniotomy surgery, and so I had to recover from that, and I had to learn how to walk again. And I noticed that people will show me a lack of patience, or they will treat me as if I'm not, a normal person. And I see that today because I didn't, I've gone my whole life without these types of disabilities. And then I end up with these disabilities. And then I see how I was treated, once before, and now how I'm treated now. But what I had to learn was, and it hurt, I had to learn that that was the character of the other person, not my character. And, but it was painful. So people who were bullied and people who just start out receiving, bullying. Oh my goodness. I mean, I never received bullying till I, ended up having a disability. And then I would, I've been called names. I've been treated with lack of patience. I've been, people will, treat me like I need to rush, or, it's, it breaks my heart that humanity isn't kinder.
Yeah. Yeah. I've been, fortunate so far in that I've not really dealt with anything like that yet. But like I said, I live in a small town and I'm not really exposed a lot. So I'm exposing myself a lot by what I'm doing here. But this is what I feel compelled to do. But I think the strangest thing that has happened to me, and I didn't feel bullied by it. I'm not sure how. I still don't know how it made me feel, but the strangest thing that has happened I was just at, the pharmacy one day waiting for my medications. And, I keep my head covered. People can tell that my hair is growing back and stuff. So people know that I'm, dealing with cancer. And I think the strangest thing that happened was there was a man who intentionally stared at me just long enough to get my attention so that he could just smile at me. And I honestly don't know, what his intentions were with that. I didn't, I smiled back at him, but I didn't speak to him or anything. So I don't know what his intentions were, but it just felt so strange to me because that's the first time that anybody's ever done anything like that to me. And it just felt odd. Um, but I understand that things like that are going to happen now. Because I look different to people, and like I said, I live in a small town. To my knowledge, I'm the youngest person in this town with cancer right now, and we got one Walmart and one street light, and so everywhere you go, people see you, and everybody knows who you are. So that to me was just strange, but that's something I'll just have to get used to.
Yeah, I mean, I had to too. I had to just accept the fact that, you know, um, I had to grieve the loss of my good health, and I had to accept who I am today, and I have to stop and just smile. And some people will say, well, like on that last video or whatever, so I got some messages where, oh, you're rude. And I had to stop and think about that for a minute and go, okay, where was I rude? Okay, I wasn't rude. So I had to just put through my mind that that person didn't watch the entire video. And that's on that person. And but it's very challenging when you are willing to put yourself out there and then you're scrutinized. So Little Rosie, I just want you, I want to protect you. I want to put you right under my chicken wing and keep you safe. I know I'm not going to be able to do that. I know I'm not going to be able to follow you in every live stream that you go in. I'm not going to be able to be there and have your back every time somebody might get out of line on social media or even in person. But I just want you to know that I'm there for you, and you have a way to contact me. And if you ever need me, I'm going to be there for you. But there are some really rotten keyboard warriors out there. And, I hope you're listening to me. If you're out there and you're watching, I'm not talking to the people in the chat room right now, and I'm not talking to you, Little Rosie. I'm talking to the people that are just listening and not making themselves aware, or maybe coming across, not making themselves known, or gonna come across this video after it's uploaded. I just hope that you check yourself and before you start typing stuff in, you stop and think that, people, almost everybody is going through something. And we don't know what that something is. And so try to be kind, try to be kind to one another. And, if you see somebody who is visibly like Rosie, you could see, for crying out loud, you could see, that she has cancer. Ask her, are you having a good day? Hello, or tell her, hello and have a good day, and reach out and, just let somebody cut in front, of the line, and, just say hi or smile. Little things go a long way. And that's the whole thing about my YouTube channel. It's like, I'm willing to make videos for a little gas money to get people right. And I thought to myself the other day, I'm thinking, who would have a problem with this? And you wouldn't believe it. I mean, I've gotten some messages and I'm like, wow, who would have a problem? But there are those people out there, and I hate to have to even bring it up and say it, but they're out there. And I just hope that that doesn't break your spirit, little Rosie. I hope nobody breaks your spirit.
Thank you. I will definitely take my place under your chicken wing. I appreciate any kind of support from anybody who's willing to give it, and I will always be supportive of the people who support me. And I'm pretty fortunate that I'm actually a pretty tough old girl myself. I, I'm gonna always be very polite and well spoken and very serious when I'm having serious conversations. But at the same time, I can sure enough dish anything that somebody wants to throw at me. Um, and I have to touch on something that I've heard over and over, especially here on YouTube, is hurt people, and the people who behave that way and have to put down others to make themselves feel, but I don't know what they're going through, just like they don't know what I'm going through. And the people like that are going to do what they're going to do, and it's up to me to decide how I'm going to let that affect me and how I'm going to respond to that. And so if the time comes, then that's something that I'm going to let my character speak for me, and they can let their character speak for them. And that's really all that I can do. I'm fully aware of what may come at me, and but I'm a big girl and I'll handle it, and I'm not going to change who I am just because somebody else wants to come after me.
I agree. And I decided to do a video. The next one is going to be on healthy boundaries, and I wrote some thoughts down. I'm very new to YouTube, so I'm not a seasoned YouTuber, so I'm not wrapped up in this. I'm not vested, and I'm not so wrapped in this society, in this world, that the seasoned YouTubers all know, and they feel that they have some right to know some very personal information of others. But I've only been on here since Thanksgiving, and it's like there is nobody I know that is a very good friend of mine yet. You know what I mean?
Right.
These relationships are just establishing, and there is nobody who knows me or I know well enough that they have some sort of right. And I've already been aggressively approached, and it's like, wait a minute. I haven't even finished making phone calls. I haven't even talked to my dad. So it's like, wow, the last thing I want is for him to hear things secondhand,
Right.
So it's like, wait a minute, who in the heck do you think you are? If you think that you know me well enough to approach me nobody here does. And it's, would you do this? In my mind, it's like, would you approach me to my face and ask me that?
Oh, of course they wouldn't. Of course not.
Really? Right. So, I mean, if I don't answer you and you can't answer that question, with a yes, it's like you're out of line, get in your own lane, you know.
Yeah.
And one of the things that I agree with you is never mistake kindness for weakness, because just because we're going through an emotional bump in our road doesn't make us weak people. And just because we've been diagnosed with an illness doesn't make us weak people. I am really trying to be strong and not show a side of me that I could go just like any other woman, 0 to 5 seconds. You know what I'm talking about.
Yeah.
We all can go there, but a lot of us don't like to have to do that. And, but you push and you push, and you may find out that my trigger isn't like what you're used to, and you might not like it. And because I'm really a peaceful person, so it's just not something, I just don't understand that with people that you don't know. Why would you want to trigger somebody you don't even know? You know what I mean? That to me would be the scariest thing. I would never do that to somebody I don't know, you know?
And that has to be some kind of terrible insecurity in them that would cause them to do that. I can't imagine wanting to treat anybody that way, or to instigate that kind of behavior with somebody. And I think a lot of that is because of the security that I have in myself, and I can only imagine that it is some kind of insecurity that they have in themselves that would cause them to treat people that way. Tatted T is here, Sweet Meadow.
Hi, Teddy T. How how are you?
He said he
He said
finally found you on.
finally found us on. I sent him a DM earlier. He said he would always be here. Um, if we needed him, he's a who Tatted T is, right?
I do. Not very well. Like I said, I haven't been around here long. I actually just got turned on to him just a couple of weeks ago. So I've been, watching some videos here and there and getting to know him and Mrs. T, and they're great. I really enjoy them.
They are. And I had sent him a DM and asked him if, after, we talked a bit, if he wanted to come on. Would you like him to join us? Or
Sure, that'd be great.
Tatted, would you like to join us? Do you want a link? Or he's so uplifting. I just, I gained so much strength from listening to Tatted. I just do.
He's very well spoken. He has a way of expressing himself that's is just a very positive influence.
It is. Tatted, you want to come on? You want to hop on just a little bit with us? I'll send him a link, and if he wants to, and he could ask a few questions. Is there anything else you want to share, Rosie, to share your experience, strength, and hope? You know that you can also share this video into your playlist as as a part of sharing with your family.
Okay.
You
I
know,
will.
all you
I'll
have to
definitely
do,
figure out how to do that.
I can walk you through it on Twitter, how to do that.
Okay, yeah, that'd be great. Yes.
Tadity says, sure, I can join for a few minutes. Okay, so I'll send him a link. And let me find him on Twitter. Oh, I think let's see. Twitter or email. Let's see.
Right now, it's kind of just easier for me. Like, like I said, this is my first live stream. And right now, it's kind of just easier for me to answer questions and, just like a back and forth on a topic. Just because, like I said, I'm still really new to this, and the chemo brain, it makes it difficult for me to form my thought processes independently. So, as I get more used to this, I'll probably be better at doing that. But right now, it's kind of easier for me in a Q&A and a shared thoughts form of discussion.
Yeah, it is. It's easier for me to. I know it's hard. I'm looking for his email real quick. Let's see. Okay, I got it.
I don't think I have his Twitter. I'm gonna have to find him on Twitter. I have really enjoyed talking with you though, and watching the chat what little bit I can. You and I have you know I feel like our discussion has been really easy, and I know that I just saw everybody seen me take a toke off a cigarette. If y'all have got to tear into me, then that's what you got to do.
Oh
it's
no.
it's something that I'm working on.
Nobody's gonna tear into you.
I'm not perfect by any means. This is something I'm still working on me, folks. I'm still working on me. I'm so embarrassed.
Don't be embarrassed. There's a lot of people who smoke and vape. Don't worry about it.
Oh my gosh, I thought about vaping. I thought about it. And it's like every time it crosses my mind, I will see a news story in either Twitter or Facebook feed of somebody's vape exploding and blowing half their face off and their teeth are gone. And that terrifies me. So I have not converted to vaping. That is the last thing I need is to blow my face up on top of everything else. Is Tatted T still here? I think is he having some
Yeah,
trouble?
I think he says okay. Yeah, he's still here.
Okay.
I sent it to I sent the link to his email. Um, but if he wants it sent to his Twitter, I could do that too.
Okay.
We'll just give him a minute. It takes a minute.
It does, yeah. It took me a minute too. And Bob, I see that yeah, you saw that story. It's like there are new stories every day about vapes. And I mean, I know it's been great for a lot of people. It's helped a lot of people, but there's a new story every day about a vape blowing up in somebody's face. It's scary.
Oh, gosh, I didn't know that. Hi, Tatted. I see him. He's on.
Hey, Tatted T.
Let's pull him up top real quick.
We got 3 survivors in the house.
All right.
Here we are. 3 cancer survivors. Little Rosie, meet Tatted T. Tatted T, meet Little Rosie. Did you hear his story, Little Rosie?
I have not heard like his full story. Was it colon cancer, Tatted T? Was that it?
Yeah, colon cancer. Yeah.
Yeah, like I'm still really new here, and I'm just still working on following a lot of people in the cancer community and catching up with their stories. So I don't know your whole story, but I have been watching and trying to get caught up with you.
Yeah. I don't know much about you either. I don't know what type of cancer. Could you tell me real briefly again? Can you do like a quick recap since I didn't get to hear you?
Yeah, sure. I have stage 3 multiple myeloma, which is a blood and bone marrow cancer. And what it primarily affects is, my bones. I have multiple holes in all of my bones, and of course it affects my blood levels, and that is, it's just a blood and bone marrow cancer, and there's no cure right now, but there is a lot of effective treatment and a lot of really good research going on.
And how long you been battling this?
I was diagnosed in March of last year, March of 2017.
And or you do chemotherapy and radiation, or you just one?
Not radiation. I'm currently on a oral injection and infusion cocktail. And in September of last year, I did have a stem cell transplant. So those are the treatments that I've had so far. And I'm currently taking chemotherapy, the oral and injection and infusion.
Wow. Well, my heart goes out to you. I was as a cancer survivor myself. It's not easy. So I know that the pain, as well as sweet metal, it's hard. It's rough, and I think at a point it comes where it's really hard mentally, because of what we have to go through mentally, and so we have all those emotions on top of what we feel on the physical. So it makes it really hard. So. Uh, I mean, it's very unfortunate for cancer for anybody to have it, but at the same time, it feels good to know when you can join together with other fellow survivors, or someone that's battling it, because they can relate on, like, right on that level. You know what I mean? So uh, I'm
Exactly.
sorry.
That's what Sweet Meadow and I were discussing earlier, is the the importance of having support and communication with other cancer fighters and cancer survivors, because that's it's a level that you can connect with people on, that you can't connect with anyone who's not a patient.
Yeah. So
And as much as I have struggled physically, by far the mental um impact of this has weighed on me far heavier. And this, being able to reach out and communicate with other cancer fighters and survivors, I already feel a very positive mental impact.
That's wonderful. You can always go into Tatted streams. He goes on live a lot. You go on at least once a day, right, Tatted?
typically, that's what I do about now. I kind of took a little step back, had to get my mind right, and had to
Yeah.
get my head sorted and got my mind cleared and come back on all fresh. But usually I try to do about once a day because I like to be there for one another. So
Yeah. And so, Rosie, you could always go in his live stream and you will always be embraced with, he will always embrace you with a positive hello and love. Him and his wife are very compassionate people. Tatted has been through, he's got the roadmap to, where and back. So, he knows all about what we're dealing with. And they are very loving, kind, compassionate people. I jump in his live stream. Sometimes, I try when I come into people's live streams to say hello. Sometimes I don't have, I'm at work and I just, I'm listening or what have you. But there's always, he's got a great stream that, he does. And I'm glad that he comes on and provides that, place for people, to come in and chat and bond. It's important.
It is. And no longer than what I've been here, I've just been participating in chats for just just a couple of months. And I've only made 3 videos, and I feel really blessed that so far, I feel like the connections that I have made, and the people that I have been in contact with have been really, really good people. And I feel really blessed for that, because I know it could have went terribly the other way. And I'm really feel fortunate to be speaking with you, and to be speaking with Tatted T, and just the people that have connected with me. And I'm very fortunate.
I'm glad you're building your support system. It's important. It really is. Yeah, there's a video, colon cancer and Tatted T, on my channel. And, Tatted, you can save that to your playlist so people can view it from your playlist, and you can make that public, and then, it's on your playlist. But that was, the feedback I got from that is one of the most loving and moving stories and interactions with 2 people that, quote unquote, people have messaged me and said that I have ever heard. And that's quite the compliment to both of us, Tatted, right there. That we've grown as people to be able to have that interaction. We've grown that much to, share what we've been through. And, you tell your story, and me being able to present it, or however, whatever my part in it was, that is one of my most liked videos, and most commented about, and most messages that I've received. There's a lot of people who really appreciate that.
Well, I appreciate the opportunity that you had given me to come up on the panel to give a little bit of my story. And again, pardon that I'm late. I actually I was multitasking, and I guess I was thinking East Coast, and so when I didn't see you on at the time that you said, again, I was thinking East Coast. So I thought that maybe you guys had changed the day or the time. So I bounced a couple times back and forth and didn't find you. But if you don't mind, I have a couple questions for you, Rose. Is that okay if I ask you a couple of questions?
Yes, of course. Anything.
Okay. Because this obviously is your story, your journey, and I want to give that respect and keep that, on you. Um, the far as like, like me and Meadow had talked about on the prior live stream, is we have like our foundation of like what gets us through, and you may have covered some of this because again I missed it, and I apologize. But is there anything in particular that motivates you, that keeps you going, to keep up the good fight? Are you like a woman of faith? Is there anything that you practice that gives you that strength, that encouragement to continue, and to continue the fight? Like, I guess I'm just want a little bit of your background of what you're about.
Yeah, yes, I am a Christian. And my primary motivator is my family. I've got 2 sons. My oldest is an adult, but my youngest is still 15. And I told everybody in here earlier that when I came out of shock one of my first thoughts about this diagnosis was that God has a reason for this and he has a purpose for this. There's something for me to do with this. And that's what I've prayed about every day since my diagnosis, is for God to lead me in his way so that I can serve his will, do his purpose through whatever this is. And I don't know what it is. I may never know what it is that I'm intended to do with this, but I do pray every day for God to lead me in his will to do whatever his purpose is for me in this.
And well, I can kind of touch on that for you a little bit. For one, you're a beautiful inspiration. Uh, for even coming up on here on the panel to share a little bit of your journey of what you're going through with the cancer. So know that you're a beautiful inspiration. You're a beautiful person, a beautiful lady inside and out. I can sense that already. Also, you're a light to other people who are currently going through it. And you're coming and you're going. You truly, I don't think you realize that. And again, I don't know you personally. We've never spoken directly, but I'm the type, being of faith like you, I believe in being led by the Spirit. And that's what I'm picking up with you is you don't realize how you're being used and you're coming and you're going. And you are a beautiful lady inside and out. And the cancer and the treatments of what all you're going through, that doesn't take away your outer beauty. You're still just as beautiful. And I feel like you need to know that, sincerely. You need to know that. But you are, like I said, you're encouraging, you're giving hope by sharing your journey and the battle that you putting off. So that's very important. As you know, as someone who's going through cancer, uh, when someone going through cancer, like, and I'll speak for myself, when I went through it, I didn't have the family, I didn't have all that. My situation was different. Also, I was young, and but just other people, like far as patients in the hospital that was in rooms beside me, through coming and going through the transfusion rooms. Each one, I mean, it's like we're each other's strength, so to speak. I mean, that literally, it's like we may be feeling low, we might be having a hard day, and the fight seems a little too hard that day, versus someone else who's fighting it, that we cross paths with, is that strength, because they can help lift you up, like when you feel weak. And that's kind of the beauty for us when you fighting it and overcoming it. And I already speak overcoming it, because I truly believe all is well. Speak that you are an overcomer, and I can talk to you like that because you have let it be known that you are a woman of faith, that you are a Christian. And you just be mindful of that. That the gift is in the tongue, as you know. You have what you speak. You continue to speak life. Speak life in your body. Speak all is well. Speak blessing, speak life. And I stand in agreement with you. You're in my prayers. I stand in agreement with you, that you be made whole, refreshed, refilled, revived. That the cancer has no place in the body for a child of God. That's truly what I believe. It didn't come from God. That cancer did not come from God. And for whatever reason, there's a season for everything. And we have these storm clouds to overcome. And totally that we feel like we're being consumed by it, and it weighs us down. And but the thing is, for you, being a woman of faith, that you're not alone, that God's with you. And I truly believe that you coming up on here, and again, I'm just learning of you just now, like, because I haven't spoke to you directly, but I do feel like uh, you don't see the full picture of what an inspiration, how big of an inspiration you are to other people. Um, but also at the same time, I know that clearly there's days that you need to feel that strength and that hope from other people, because you feel at times like there's just some days that, how do I do this? How do I lift my head up? How can I smile? How can I do this? How can I do that today? This is just too much. I'm tired. And your mind, you know, you're worried, and that fear that you have, which is totally understandable. I've been there. But he sees that. Most importantly, know that he sees that. And I'm truly, I thank God that I caught you on here in time to get to speak with you. And I'm sorry that I'm late. I cut a few times come up on the channel and I was missing because I didn't know the time zone thing. But know that you're not alone. That you have Sweet Meadow. You have myself. You can hit me up on Twitter, HeartGoBang35. My emails on my channel. But you're not alone, and the courage, and I don't take it lightly being a cancer survivor. Anybody that's going through it, even the ones who have overcome and who are cleared in it, to share that story, to come up on a live stream, or even in your day-to-day life and passing one another, you're very courageous. To share that, it truly means a lot to me, because I know when I was going through it, I had so many questions, and I didn't understand. And of course, I was younger too, but I wasn't getting any answers. So it's like seeing that, and the way that this platform has taken place on Sweet Meadows channel, that platform, she's made clear that it's for things of such as this, and it's so beautiful because we all need that. Ones who are currently going through the fight, those who have overcome. Um, and again, you're an overcomer too, but I'm talking about the ones who are done with treatment. Or like this, that's the beauty of this channel that I love about Sweet Meadows, is that we're truly we can come together because we can relate. We know that pain, we know that fear, we know that struggle, and the highs and the lows. We can relate with. Now, of course, not every one of us, their circumstances are exactly the same. We all have our own different ways of handling things. But know that I appreciate you for coming up on here, sharing what you've shared thus far. I'll have to go back and watch, obviously, the beginning of it and all that. But know that I appreciate you. I love you, and I'll speak all as well with you because, like I say, this tattooed on my arm, Isaiah 53:5. You remember that. Remember that.
Thank you very much. That it really means a lot to me because I was really nervous about doing this and about coming into this community and into this platform, but I kind of had to work it out with myself that this was something that I needed, this kind of community, this kind of outlet, this kind of connection. And not only that I wanted to receive support, but I wanted to be able to give support equally. And so I kind of just had to work it out with myself that what I wanted to do, the positive impacts outweighed any of the negative that might come with it.
Absolutely.
I think we can all agree on that. On that point right there is one of the strongest instincts that we all three share, is that we feel that in order to keep what we have to give it away. We have to share our story and help those, or at least have something for somebody else to come to and take away something from what we have to say, find an answer to, not everybody's going to find their answer in our stories. But maybe as simple as the message is that, find a support system, build a support system. One of the wonderful things that both you and Tatted have in common, and that you're willing to do, is both of you, stay close to home. And you're building support systems right there in your home, and you're showing other people it can be done right from your own living room. And you don't have to go through this alone. And that right there, is wonderful. I get out and about and I do my thing, and part of my thing is running people around, and I'm good with that. So, I get a lot of socializing in there and networking that way. But we're showing people that you can do it either way. You could be out helping people by giving rides and networking that way in the chemo room, and bringing lunch or making coffee, or you could be in your own living room and helping people network and being available. So, it doesn't matter what your situation is. You can do, you could build that network of people, that support system.
Yeah, and this is a kind of support system that I never even crossed my mind until a couple of months ago when I started watching YouTube and coming across different people and different stories and things, and I would have never even thought of this being a way to reach out and connect until a couple of months ago, and it actually, like I said, has turned out to be a really positive thing for me so far. And I'm really looking forward to getting to know more people and more stories, and being, like I said, not only receiving support, but giving support. It's a way, like I said, I can't work anymore, and, I do what I can here at home and everything, but, it would make me feel really like a valuable member of the community to be able to give that support back as well.
And that's the beauty in you that I see. Like that's what's so inspirational about you is you going through it. You still putting up the fight, you going through it. But at the same time, while you're going through it, you're already wanting to give back. You know what I'm saying? Like you feel that in your heart. You want to give back. You want to help others as well as you in the midst of it. Now, I myself, once I was cleared of the cancer and all that, I went back to that same hospital that I lived in, and I worked there for about 5 years, and um, that was my way of giving back, so to speak. Like because it was working with cancer patients and stuff like that. But I just think that's so beautiful that you say that, because I mean, obviously it's beautiful, like what Sweet Meadow does, and even after the fact, when all said and was done for us, but you're still going through it, but you already are trying to be that voice and that hope for other people, and you're just truly a beautiful soul to have that type of heart and be mindful of that. That even though you're going through that storm and you're fighting that battle, you still want to be that hope and help others. And you're truly a beautiful person for that. And I appreciate that as a cancer survivor. That's very important in this community. Not just the ones who have overcome and they're done with treatments and we're labeled as the survivors, but the ones who's going through it, that is very important, I think, because a lot of people that battle that, if they see others that are still currently going through it and can have that mindset that you have, and no, it's not always easy. I know it's not always easy for you, but that's the thing, like your mind and your heart, and but the heart, you know what I'm saying? Your heart's so beautiful and pure. Yes, your mind, it gets tired and grows weary, but your heart overcomes that. It trumps that, and you're truly beautiful. I just want to again tell you thank you. That even in the midst of the battle that you have going on, that you already want to be that hope and to help others in the middle of it. So you're a beautiful person. Thank you for that.
And I thank you. I appreciate that so much because I think we all have different ways that we can contribute to the community. And, maybe later on my contribution will be something different. But right now, this is just what, I felt compelled to do. And maybe I don't know, maybe it feels a little bit selfish because it's just as much that I need the support as it is that I want to give it, because we're all at different stages. Somebody was diagnosed today. I've been in this for almost a year. You guys have been in this for quite a while, and we're all at different stages. We all have different things to contribute, and I think that each different perspective, each different ability is so very important, because we don't know what anybody is needing at a certain time. And, maybe somebody is needing what I have to contribute. And so I'm definitely going to be, focused on that, because I know that, like, you guys have things that I need, and you can contribute to my wellness and my support. And so I want to be that same kind of contribution to somebody else.
Absolutely. That's how it works, sharing and being there, We all, we get scared at times because it's in the back of our minds, I'm scared right now, just waiting, you're going through it. You don't know what, the next day brings. And Tad, he's not guaranteed tomorrow either. We're all in the same boat. We have today. And so that's what we rely on, one day at a time, and just for today. And do the best we can to share, experience and strength and hope and love and positivity and kindness. That's all we can do, put ourselves out there and hope for the best, and let God take care of the rest. You know what I mean? We have to leave things in His hands, speak our piece, and share what we know, what we've been through. And so far you're looking at Little Rosie, you're looking at 2 long-term survivors. Well, I think Tad is longer term than I am, but at least 8 years for me, and I'm hoping for more. I'm hoping for a few more years here.
Sweet mother, I know it's gonna be many more. You take someone like me. I was the youngest in the entire nation at the age of 12 with advanced stage colon cancer, the youngest ever had it. I wasn't supposed to live, as I have shared with you all a little bit of my journey. But let's see, how many years now? Let's see. 22 years.
Wow.
Since my last chemo treatment, you all. 22 years.
22 years out of treatment. Yes.
You tell me.
That's amazing. It's amazing. Praise God.
Yep.
So when you say that, Sweet Meadow, hopefully, little bit, you got plenty more. I'm a living testimony for you as well as Rosie. There are many more. Many more.
I'm looking up to you. I am certainly not looking down. I'm looking up, and I'm hoping. I am hoping.
Absolutely.
And I'm hoping for Little Rosie too.
Yeah, absolutely.
Me too. Like you said, all we can do is put it in God's hands, and He's in charge of this. This is already taken care of with Him. It is well with Him. So I know, that all I have to do is keep on keeping on, and let Him take care of it, and my life is handled with him. I'm good. So, whatever time he gives me, you know, my main focus is to serve him well, and I'm good with that.
Absolutely. My wife said 21 years, I think. No, actually, on February the 13th of 1996 was my last chemo treatment. So it's my 20s. That's really important. Every year counts for me, wife. 22 years on February
Absolutely.
13th.
Well, part of your story, I think, didn't you say, Tatted, that you don't like to look back, and you did. I think you said you didn't like to count it or whatever. You didn't like to look back, so I think we forced you to. I think we made your mind go back and count it. I think we just made you do that because I think in your story you were like you never looked back or something like that.
Yeah. And that's the thing, like, and I wanted to make clear that 22-year because uh again, because I'm just one of many hopes that God uses and testaments of how we can overcome, because you're talking to someone here on the panel who was given a 0% chance. The cancer had spread, it was in my appendix, and I mean, it just that was what they were saying, that I would pass. And look at me, 22 years off of chemotherapy. It started 24 years ago. So now 22 that I'm just now approaching February 13th of being off of it. So uh, wow. I mean, no matter how dark the situation looks or may feel or may appear, uh, when the doctors may be saying this or saying that, I'm a living testimony that, hey, God is way bigger. He's the author and the finisher. And for whatever reason, He has me still here. And I'll always just be a mouthpiece for Him. When I get in myself, I'm corrected, but I try to keep my mindset right because I do want to be a positive light for others. And but remember that it was such a dark place that I was in. Here I was on my deathbed with them just looking down, shaking their heads, and like he's not going to make it. The chemo running in one of my veins and blood transfusions in the other, and hundreds of surgeries. But look, I mean, uh, even though it seems so dark and so cold and so lonely and so scary, through all that, look what came up. I'm just a living testament. I would be the biggest fool to set back and not say something and give a word of encouragement that, hey, that can be your situation. That can be your case just as well. Because God is no respecter of person. He loves us all just the same. And so I'm gonna, stay encouraged. Wouldn't that be awesome that all of us come around? I mean, I can imagine what I'd look like in 22 more years, but how awesome would that be that the community and this channel is still going and we could all come back and you hit that 22-year mark, sweet matter, and we all talk, I'm like, see, all is well. Like, that's how I look at it. Like, that's not too far-fetched to me. That's not uh unrealistic. Like, that truly uh, could very well be y'all's outcome. And I'm just that little bit of hope that God uses to share that with one another. That, hey, no matter how bad it may look, no matter no matter how the symptoms, you still stand on God's word, regardless of the circumstantial and the symptoms. You still speak life into your body. You still thank Him for it because you are alive. And you continue to just allow Him to carry you through, and He will. I truly believe that. Why do I say that? Because He did it for me. He did it for me.
And Tatted T, that's something that I feel right now is just another indication that what we're doing is a good thing, because the fact that you don't like to look back and count, You know, I can understand that. But at the same time, I needed to hear 22 years. I needed to hear someone say 22 years. And that was good for me. And so, you know, if we had not been connecting like this, you know, I wouldn't have had that. I wouldn't have heard that from you, that inspiration, that moment. And so, yeah, even if you have to look back at something you don't have to look back at, you know, if God led you to say that, to say 22 years, you know, I needed it.
Absolutely. That's why I always try to keep my mind right, because I know that my day to day, there's a bigger picture to just I and myself. That's why I try to always keep my mind right. Obviously, I'm human, I'm flesh, and I have good days and bad days. Some things, some people get to me, but I try to always try to keep my mind in check and line it up with my heart, because for exact reason as this right here, I felt led. I wanted to make shit loud and clear. 22 years. I felt led to share that, and like Sweet Meadow said, I don't like to look back. I don't like, because I suffer from PTSD from that, and from dealing with the cancer, and it's horrible. It's scary, and the hardest thing for me is the flashbacks, and again, for whatever reason, and you even said just now that you needed to hear that 22 years. Again, so that's that hope, that's that encouragement, that's that light that you needed, and I thank God that I was able to come up on here, as well as be a willing vessel, just a mouthpiece, and to speak from my heart of what He's done, and the hope that He gives us through Him.
He has a calling. He deleted videos and then didn't live stream for a couple of days, and then he come on and say, I don't know how y'all heard this rumor that I was leaving, but you laughed at it, and some of us got a hold of you and pulled you back, and you know what? You need to be here. And we're glad that you decided to continue on, because you know, I can't do a live stream every day, and there are people who need to come on every day, and there are people who need to hear your message and your hope. And you know, you did have a moment of disparagement. You were like, or at least that's what I was seeing. Maybe I'm speculating, but you know, I thought you were getting a little discouraged, and then I heard a rumor, and so I sent you a DM. Hey, don't leave. I don't want to see you go. You know, you have a calling here. You have somebody. You have not somebody. You have people that you're inspiring, and you know, there's cancer survivors that need to connect with you. And you know, we gotta make sure that, you know, we connect them to you, and you know, connect them to me. And you know, I'm glad that you're doing that. I'm glad you're coming on. You know, I pop in and I listen. I may not be able to participate a lot because I'm usually listening while I'm shuffling around a lot of paperwork, but I am listening and I am participating in my heart. So don't think I'm not there. I do pop in and say hello, and then you might not hear anything back from me, but I'm with you. And
Means a lot to me.
I truly am. And Rosie, you know, I hope that I'm able to put you in touch with somebody that you can add to your support system along with me. You can add me, but add Tatted, and then know that you can DM me and I'll always answer you back, but you can always join in on his live streams. He has a network of people that are really kind, loving, compassionate, and caring. And they show it. they type it out. They are wonderful people. And, you don't have to worry about, anything, because Tad, he'll get them out of there if they get out of line. There's just, it's a safe place. What does this shirt say? All is well. I have been saying that to myself. That's why I'm going to get his shirt, because when I hear him say, oh gosh, that's his signature line. He would just say that. And then it stuck in my head. You know how a commercial song will stick in your head, and you'll find yourself folding laundry one day and just singing that tune? Well, I'd be having a bad day and just go, all is well. And then I'd think of Tatted, all is well, all is well. So now I need the shirt just to wear it, so all will be well. And I'll have that right in front of me, reminding this built-in forgetter of mine that all is well, because all is well. Because we're not the director of this play. We are not the director. We're just a person in the play. There is a director, and that's a power greater than we are.
Yeah, and like I said, I feel really blessed that that you two are the ones that I'm speaking with tonight, that I'm here with tonight, that I'm connecting with, because I do feel like I'm safe with you. I feel like I do have the foundation of a good support system with you guys. I feel comfortable with you, and I'm really, really grateful, and I feel blessed.
I'm glad. We need a strong support system. What we have to deal with just with our own thoughts, is enough. I mean, we can already, figure out the worst. We don't need help. So we need that support system to lift us up, and to remind us that, like Tad had said, there's a bigger picture here. And we got to have faith, and we got to trust in that bigger picture. And there's a reason why Tad's here today. And there's a reason why I'm here today. And there's a reason why you're here today, Rosie. There is. Make fun of me, but we might be earth angels. We don't know. I mean, what is an angel? What is the definition? You know what I'm saying? We might be. We don't know. We don't even know.
Absolutely. And we have some purpose. We do. Mm-hmm. God loves us enough to give us a purpose, and to to be good and faithful servants to Him. And I believe that's what we're doing. I really do. I feel like I'm following what He wants me to do, and following my heart. And I believe that I will be able to serve whatever my purpose is to Him.
I think you already are. You're reaching out, and you're telling your story. And right there, you're helping another person. You're helping another human being just by making yourself available and reaching out and having the courage to say, hey, I'm going through this, especially in a community that is so willing to prove you wrong or dox you or whatever they call it, You're willing to walk into this and say, here I am. This is who I am, and this is what I'm doing. And that's courage.
Yeah, and that's one of the things that occurred to me, and I'm aware of it, that I could get asked for receipts at any time. That could happen, and I don't have any problem with doing that to a certain degree. You know, I don't want all of my like private personal information out there, not out everywhere. Certainly, I'm going to the people that I connect closely with, and I actually do develop a relationship with, I'm going to share more with privately if I trust them. But as far as anything about proving that I have cancer or whatever, that's something that I'm perfectly comfortable doing, because if I'm gonna come here and be willing to put myself out here and stand by my word that I'm here for a positive reason, to be a part of a support system, then that's something I've got to back up, and I can, and I don't have any problem with that.
But let me share something with you. Like I said, my next video is going to be on YouTube creators and healthy boundaries, and YouTubers and healthy boundaries. You do what, like we talked about earlier. Okay, I've created my channel as of, I think, Thanksgiving. I don't owe anybody any documentation or anything. It's a choice if somebody wants to believe me or not. And they can hit the unsubscribe on their way out. Okay? The only thing I was interested in was getting 100 subscribers so I could live stream. Okay? I'm not looking for anything to where I'm looking for somebody to hand me thousands of dollars. Now, I understand people lost money on this other person and they're skeptical. But you don't have to listen to me. You don't have to, you don't have to do anything. But I share my information on an as needed basis. So if you were to become a very good friend of mine and you asked me, yeah, I would. Yes. But just for the sake of satisfying a room full of YouTubers, absolutely not. I'm not going to sit there and subject myself to any more pain that I already go through on a daily basis to satisfy people I don't know. I know that I've got a cricket, and that cricket is chirping, and that person can continue to chirp, chirp, chirp. What are you chirping about? I'm recommending lemons. I'm recommending green tea. I'm making my own dog food. I've had Tatted on panel. I've had you on panel. I've had Uber Goober Lady on panel. You got a problem with that? Whoa. So you're chirping behind my back. It's like, wow, get a life. What's wrong with it? What's wrong with what I'm doing? I'm not taking from anybody. You want to call me out as a liar because you're the YouTube police. Well, live with yourself. I don't answer to the police in real life. You think I'm going to answer to the YouTube police? It's like, get a grip. Just be wise and know that you don't have to, Little Rosie. If somebody starts doubting you, you do not have to prove yourself by giving documentation or anything. Like we were talking about earlier, if somebody chooses not to believe you, that's okay. They don't have to. Think about it a minute. Just do the math with me. Just follow me on this one. Okay, say you got 1K subscribers. I don't have 1K subscribers, and I really don't care if I ever get 1K subscribers, okay? All I wanted to do was make videos, and I found out I could do that without 100 subscribers. Then I wanted to live stream. I found out I needed 100. Well, 100 is, if you work for it, it's very easy to obtain. You just keep working at it. But after that, I'm done. I don't care. I'm not in a competition with anybody. I'm not asking for nothing. I don't care if you like my videos, people, or not. You know, I have faith that my message is going to reach those who need it. And I think my higher power has already shown me that they are reaching the people. And I'm already networking with beautiful people. Look at Tatted, look at you, right? There's proof right there. So for me to feel like I'm lesser than and be bullied enough, you know, like somebody came in my live stream and said, well, we want to know about you and what happened at your doctor's. Well, guess what? I told my family. Who are you? You know, who are you? Pop in here. You don't care about me. You say hello to me once in a while, depending on the live stream. And you want me to feel obligated to tell you my most personal, what me and my husband are crying at the breakfast table over? Get out of here. You know what I mean? This is my hardship. I'll share it with the people I feel good about sharing it with and comfortable enough to share it with. But I owe nobody, absolutely nobody, an explanation.
Absolutely. I completely agree with you on that. And, you know, if I were to share any kind of thing personal like that, it would certainly not be on a basis of I felt like I had to. I may have misspoke when I was talking earlier about, you know, providing receipts or whatever. I think I misspoke, and I'm not going to do anything like that based on a situation where I feel like I have to. That would be something that if I chose to share anything like that, it would be because, you know, I felt compelled to for a positive reason. And, you know, certainly I would be selective about who I shared certain things with. And, you know, like I said, I'm just now starting to build relationships and you know, build foundations for relationships. And those are, you know, as much as the community is important to me and the support system, individual relationships are going to be very important to me too. And I am definitely going to have a clear separation of you know, the community as a whole, and my, of course, always respectful regard with, you know, with regards to the community. And but I'm gonna keep, I'm definitely gonna have a separate regard for my personal relationships that I build in the community as a whole.
There you go. Good girl. Good girl. You know, you just rock on. Be, you know, be who you are in real life. Keep it real, you know.
Yeah, and that's the thing. You gotta be real, or it's not. What's the point? You know, you're not gonna impact anybody else's life pretending to be something that you're not. And so I don't I don't have the time or energy to do that. So that's, I'm definitely gonna, you know, keep it real here the whole time. Even if I have to say, you know, that's crossing a line for me. I'm not ready for that. I'm not prepared to do that. Um, I'm going to be comfortable with drawing my lines where I need to.
Good. Good. Because, I mean, you know, I do understand where the YouTube community that we chose to be involved in is coming from. I totally get it. I understand. I see it. I understand. But there are those that have gone way too far, and but that's going to come back and bite them, and in due time. And so I just choose to put the shovel down and back away from the hole. And I'm not going to contribute. I'm not going to get involved. I'm not that type of person, and I don't want any of it. So, and when it comes my way, I'm going to do my best just to stay true. I have a saying, to thine own self be true. And I'm just going to be true to myself. And then if I do know how to unplug. So if I have to unplug for a couple of days, I will do that. I'm not addicted to this, and I'm not vested. I mean, there are some people on here, Little Rosie, they are in deep. They are so vested in the YouTube world that, I mean, they are literally vested. It's like, whoa, this should, in my mind, should be like a side thing or a hobby or a secondary thing.
Yeah, I've seen that, and it's actually occurred to me, I don't even work anymore, and I don't have the time to put that much, time and effort and energy into some of the things that I'm seeing on YouTube. And you're right about the people who have tarnished the name of the cancer community the way that they have, and they've done the deceitful things that they've done. That's going to come back to them. And at the same time, I'm not going to be I'm not going to let myself be held responsible for things that other people have done.
Absolutely. Thank you. Thank you for
Right.
saying that.
Yeah, we're not accountable for what other people have done. We're not behaving the way that they have behaved. We're not doing the things that they have done, and I can't be held accountable for somebody else's actions. I can only be held accountable for my own.
I'm glad. I'm almost relieved because I know that you're real new like I am, and I've seen you in live streams, and I was just like I said earlier, just want to take you in and put you under my chicken wing and protect you. So, I just don't want you eaten alive. I've already gotten a little taste of it, and the little taste of it is like, you better just keep me irrelevant, because you don't want to see, and you won't see it. It's more of a knock on your front door type thing. So I don't, like I said, I do know how to unplug, but unfortunately I've already, gained this cricket that's chirping, and, I got this monkey. Just wish that person would go away, but it's okay. They're going to stay just as irrelevant, But,
Well, they look for us. They
yeah,
look
they
for us,
do.
and
Yeah,
they know how to
exactly.
find
They're
us.
looking for us.
They know how to find us. And, I'm sure you've seen me in some live stream chats, and I can tell you that I lurked without ever chatting for a long time. And, I kind of got a feel for some of the regular people that were in the chat rooms and stuff. And then, I started chatting with people, and you'll see me calling people honey and sweetie, and I'm Southern. That's what I do. But, and, I just try to be polite and, encouraging and supporting of people. And, so, and I don't think I've ever I've certainly never drug anybody or, gotten involved in any kind of drama or anything. I watch live streams that I don't agree with everything that's being said, but, it's not my place to tell them what they can say on their channel or not. If I don't like it, I turn it off.
Right, exactly. And just because I'm in a stream doesn't mean I agree 100%. And you're right. Just because I shout out and say hello or whatever, I'm the same way. I just feel that after I've been through all that I've been through, one of the most important things for me to do every day of my life is to empower another woman and to say to that woman, I make it a practice every day to tell another female, you are pretty, you are special, you are beautiful, send a flower, even if it's typing, whatever. But I've gotten backlash from it. I've gotten, are you, trying to pick up on me or whatever? No. Or, I've gotten a little backlash. But when you have gone through what we've gone through, you make it your priority to build up another woman's self-esteem and self-worth versus tearing it down. It means so much more to build that person up, because you never know if that woman's going to be diagnosed tomorrow and she's got to go through what we just have gone through. And so I want to make sure that she is ready for that,
Exactly. And our society, I don't know how women became something shifted in our society to where women felt compelled to turn against each other and felt like they needed to put other women down to make them feel better about themselves. And I wish that I could look back and see what it is or where it was when that happened, that happened to us, how that we got programmed to do that, because we're destroying ourselves from within, and we're going to have to shift that. We're going to have to take our power back. Certainly no disrespect to Tatted T. We love you men too. We need you men. But us women are destroying ourselves from within. And we're not going to make it if we do that. We're going to have to find our way back to the right way of supporting and uplifting each other. It's, we're tearing each other down, and it's not going to get us anywhere.
I agree 100%. And the only way to, we need to learn and practice complimenting each other, because we already start tearing, we tear ourselves. We are our own worst critics as it is. We don't need help tearing ourselves down. We do a real good job of it ourselves. So, we need help. We all need help just building ourselves back up. And I'm not talking about, the narcissistic brand of building self up. I'm talking about when you see somebody who, has anxiety, who has low self-esteem, who is struggling, or who, has chronic illness or cancer or whatever. They are already in grief, and people don't understand that. They are already in grief, grieving their good health, that the person that they once knew, and they need built back up. And that's one of the biggest takebacks and lessons I've learned from hanging around the cancer crew, and for the last 8 years. I have, hung out with the cancer crew, and you've got to grow thick skin. You've got to be strong. You've got to be there for others. You can't be all about yourself. You have to give. One of the most wonderful things that my mom taught me was, if you want a friend, you have to be a friend. And I've carried that principle throughout my life. If I want something, I have to be that, or I have to give that first. And I do that. I make sure that that's a priority. And
Yeah, that and maybe we can start this here. Even if we're the only two voices that are speaking up to encourage other women, two voices are better than none. And if one person hears our voice and is inspired by it, and maybe they'll follow our example, and it, but all we can do is our part. And and pray that we have the impact that is needed at the time.
yeah, that's true. Absolutely. You are such a wonderful person. And I know that this video is going to help others. And so where do you go from here? What does your future look like, Little Rosie?
Well, I guess my main focus right now is consistent treatment, and adjusting to that and getting my strength back, getting my energy back. And I do want to, like I said, spend time focusing on the cancer community here on YouTube and getting to know other people, other members, and their stories. It's just as important to me to know about them as it is to share my own story, because I can't be the kind of support they need if I don't know what's going on with them. And so this is other than my home life, which is obviously my priority, this is what I really want to get involved in right now, is being a positive member of a supportive community.
That's awesome. Are you gonna what is the future of your channel? Where do you see that going?
I've only made a few videos just because I haven't had a whole lot of energy. But as I get my energy back, I'd like to make definitely more. I know what I want my next video to be. It's something I've been thinking about all week. I want to talk about my dream house. Every little girl, every woman has had their dream house. And that's something that's just something that it's a thought that I want to leave for my children and my grandchildren one day, to give them my detailed thoughts about that. And it's a happy thought for me to share. And it's something that, maybe other people would want to, if they see the video and they want to reach back and tell me about their dream house. It's just a positive thought. It's something that a lot of people share in common. And so that's what I think I'm going to make my next video on. And I don't think I'm going to plan much out. I'm just going to kind of wing it and just, live my real life and talk about what's going on.
Yep, that's cool. That's cool. Yeah. For me, I have just to, to continue on with, the things that I did during cancer, treatment and the scars. And everybody's heard that, the other videos that I would like to do, and just what we're doing tonight, making myself available and reaching out and being there for other survivors, because it helps me equally, like I said in the video that Uber did, with me showcasing my channel. It's a two-way street, it's not just a one-way thing. It's, sharing is caring, and sharing back and forth is, I get as much out of it as the other person gets, because it's not, it's a relationship. It's sharing and the other person's sharing. And, it's always been that way. I don't go in any relationship, friendship, 100%. I know my place. I stay in my own lane. I'm only 50%. And I know that it's unhealthy to be 100% of a relationship. That's overbearing. So I always just, but I want to stay connected. I feel, I feel like I need to stay connected, with the cancer community, because I need the input. I learned a lot of stuff tonight, I don't know that there's any, I haven't been told that there's any kind of stem cell for breast cancer. I'm going to have to read up on that. But I have, like I told you earlier, I've, watched a documentary on somebody else with a blood cancer, some type of blood cancer. And, it really, that person was the one who walked away out of the 3 people in this documentary. So I'm like really happy to hear that that was available to you. And I'm sure it's getting late there and you probably want to go ahead and end this, but this has been, I'm glad I got to know you, and I'm glad I got to talk to you, and I feel better knowing that that you have, you realize that there are those that are kind of looking at us, those of us with cancer with a watchful eye, and they're some people are being a little unkind about it, but we're not that person that, you know what I'm saying? We're not that person. We don't have to pay for that person's debt that, because they donated money and there was a scammer. We're not that person,
Right, right. And I feel really positive about what we've been able to do tonight. I'm really grateful that you reached out to me and asked me to come on, and I felt really good about it. I feel like we've had a really positive conversation. I feel like we've had a lot of good support. And I feel like it's a really good connection, a really good foundation, and I've really enjoyed it, and I look forward to, getting to know you better, and being a support to you and having your support. I really feel good about it.
Good. I'm glad. I'm really glad. I like, to establish, I like to establish positive friendships and relationships with people. I don't like conflict. I don't like negativity. I don't like, bad vibes. I don't like any of that stuff. I like, I like to just go through life sailing through, and, we already have, bills to pay, and, you know, cars breaking down, and bad luck left and right, and, you know, accidents, and, you know, people in our social circle getting hurt or injured or sick or dying, or, you know, there's already enough that we deal with in our daily life that we don't need to be throwing more on each other. It's just ridiculous. So, you know, you're not going to ever see that from me. I'm not going to do that. Nope.
Yeah, life is going to give us enough to deal with without us creating our own problems, for sure.
Exactly. Exactly. Well, Little Rosie, you know, this has been a pleasure to meet you. And I'm really grateful that you did accept the invitation, and I'm grateful that you came on and talked about multiple myeloma. Now, I didn't know what it was. I didn't realize it was a blood and bone type of cancer. And it makes sense because the bone marrow goes into the bloodstream. Is that correct?
Yeah, the bone marrow is actually where blood cells are formed.
Right. Yeah.
And multiple myeloma is a mutation and mass production of the platelets that are formed within the bone marrow. And you know, a platelet is a type of blood cell. So,
right.
And that's kind of the basics of it.
Right. And that was the whole theory behind giving the treatment off label that you mentioned earlier. I'm already forgetting the name of it.
The Zometa, yeah.
Yeah, the Zometa. I have that like sticking out of a box there. I don't know if you do this, but I've done it from day one, and this is a good suggestion because it was suggested to me by a cancer survivor. And what I did was I went to like an Office Depot or you know, one of those office supply places, and I got an accordion plastic file. You can get them at Walmart too. File folder, and it's easier to ask for all your reports at the time you go to your doctor's office than it is to ask for your whole medical record later, and they'll charge you, you know, to copy your medical file. But so I got that accordion file folder, and I've collected, you know, and I have that all the information on that Zometa treatment, or Zometa, however you pronounce it. And I was going to dig it out because with my current situation, I'm hoping that between that and another drug will, you know, be my fate and not chemo. I'm praying and hoping, and I was going to dig that information back up, and because I have all that information on that particular drug, and do some more research, because I'm like acting out of fear. I'm really worried what, you know, my next step is. But it makes perfect sense with what you were sharing with me tonight and why they gave it to me. Because like I said, that trial study in Germany, or that whatever it was, maybe not a trial study, but it was something that came out of maybe the medical journal out of Germany. I'm not exactly sure. This is what I read, is that they said that all cancers, what I read, the article had said that, and my doctor confirmed it, that's why he gave me the treatment, is that all cancer cells find a way to hide in the bone marrow. And the people that end up in remission, these cells somehow find their way hidden there and then will present themselves back into the bloodstream later. And that was why they gave me that treatment. Just to be, just in case kind of thing. And it was prescribed off label. So I can totally see why they gave it to you, not only to help build your bones back up, but to also kill any, cancer cells that may be sitting in the bone marrow. Because what is it? The chemo doesn't cross the brain barrier, and to some, I guess it's, I could be speaking out of turn totally. I'm going off of a really bad memory here, but does it not, chemo, does it go to the bone marrow? Or anything that's in the bone has to be a transplant, bone marrow transplant? Is that how that works?
Now that I'm not, I couldn't say 100% on that. I do know that, like, that inner area of the bone where the marrow is and where the blood cells are made or formed, it's something about it's the perfect hibernation ground.
That's what I was told.
It's the perfect place for them to hide and lay dormant, and then all of a sudden, when they're ready to begin to mass reproduce. And I'm not sure about the science or the biology of that. I just know that that's what I've read, is that the bone marrow is like the prime hiding ground.
Right. That was my understanding as well. And where the original study came from, or the original I thought it was, I thought it was Germany, but I'm not real positive, but yeah, that was my understanding as well. So that's why I, agreed. And for me, it was $1,000 copay per treatment of the Zometa.
Oh my God! See, I can't imagine, because like I said, I have Medicaid, and like I said, we're just small town, paycheck to paycheck people. If I did not have the assistance that I have, there's no way I could be getting the treatment that I'm getting.
Well, the reason why my insurance company wouldn't cover it is because it was prescribed off label, and they questioned the necessity and validity, and it was like, I don't know, I guess they didn't consider it, on label. So
now I will say that before I got Medicaid, I had insurance through an employer. I won't name the insurance company just because it's not even important, but
right.
They paid for, they covered treatment up until it was time for the stem cell transplant. And at that point, and I guess it's because it is, I don't think it's a very new, I think it's a rare treatment, but I think they've been doing it for quite a while. But that at that point, that private insurance company told me that, it's not a cure. There's no cure for multiple myeloma. I'm still going to require treatment, but this was the most effective treatment to give a longer lifespan. But at that time, that insurance company told me that, even if you get the transplant, you will still be terminally ill. This is still going to kill you. and we are not going to pay for it. We are not going to spend that amount of money for you to still be terminally ill and still die.
Oh.
So, at that time, I had to go through, the process. That's when I went through the processes of, dropping that insurance and getting Medicaid so that I could get the treatment, so that I could get the transplant.
Well, my insurance wouldn't cover it either, for me to have it. So I had to pay for it out of pocket. Like I said, it was $1,000 a whack, but I couldn't afford it either, but I made payments. I mean, we're not given a choice,
Right.
What can you do? You just keep plugging away, working your butt off, and making your payments. I mean, it's another bill. What do you do?
Yeah.
Um,
And the sad thing though is that I have seen people who, have done it for as long as they could, make those co-payments and pay out of pocket like that, and eventually they just get so disheartened that they say, to them it's not worth it anymore, and they stop treatment, and people are dying because of money, and that's just unreal to me.
It's unreal to me too. That's why I do this. This is what I'm doing. This is why, believe me, I have a lot better things to do with my time than to YouTube. Seriously. And this is not an insult to anybody who comes across this video. I am not insulting a creator or an artist that posts their work on YouTube, or their craft, or comedians, or anybody that just wants to socialize and network. This is not an insult. This is just me. I am literally doing this to try to, make myself available to others for one purpose, and that's to network with other people who I think I needed when I was in a place, when I was newly diagnosed, when I was, at my 5 year, here I'm at 8 year, and I'm going through this bilateral reoccurrence. I feel that I have needed to network all throughout these 8 years, so I've stayed connected. Now, when I was talking to Tatted T, when he told his story, I got to a place emotionally where I thought, yeah, I need to disconnect from this, but that's really, truly, that was an emotional moment. I seriously feel that I need to stay connected because I am feeling very connected and calm with you. I'm not feeling anxious talking to you. I feel understood. I feel that we are connecting, and this is what I need as much as you need. I don't want the anxiety. I don't want the fear. There's a sense of calm when you know that you're not the only one who is struggling with this, and you're not the only one who's going through this. There's a certain level of comfort. Not that you want anybody to go through it. It's just that you find a level of comfort knowing that you're not alone. And
yeah, definitely, and being able to feel like you're safe to talk about your real feelings and what you're going through, and your opinions and your perspective, and then feeling comfortable and feeling like you're not going to be judged, and like you will be understood. That's feeling safe to be able to talk about what we're going through is really important, and I definitely feel that.
absolutely. And I do too. And, I'll keep you posted with me. I'll let you know. I'm in the late.
Definitely. We're definitely we're in this together. We're definitely gonna be keeping up with each other, and I feel really good about this connection, and I think it's gonna be a really good thing for both of us.
Yeah. I wish we were closer.
Oh, I know.
Yeah, it was hard, but
but maybe it's this way because maybe through this, you'll reach people who are closer to you, and I'll reach people who are closer to me, and maybe it's just meant to be this way. So.
Absolutely. I do believe that. I wholeheartedly believe that. And that's why I'm not worried about subscribers or likes or everything that everybody's in competition for, that they're willing to, cut each other up or whatever they're doing. I don't want to be a part of that, and I won't be a part of that. I just feel that, everything's gonna, because it always has. Everything is always just fallen into place if I remove myself out of the way, everything works out. And it takes more effort to get me out of my own way than it does to let everything fall into place. And once I do that, I'm good. And I'm my own biggest obstacle, and I'm not that big of an obstacle in my own life because I already know, and I've been practicing getting myself out of my way for a long time now. So it's kind of like an automatic thing. I just, I do what I need to do, and I do what I feel is best. And then, I just take a step back. And like I said, I put down that shovel and I back away from that hole, and I don't end up getting buried in it.
Yeah, we can definitely be our own biggest hindrances, and that's something that's an effort every day, a conscious choice every day. And that's something I'll probably be working on for the rest of my life, but as long as I'm working on it.
Yep. You know what? I don't think that, at least for me, I make sure that I'm always teachable, because once I know it all, then I'm done.
Yeah.
I don't want to be done.
What's the point if you're not learning anything?
Right. And I don't want to be done. I want to constantly grow, and I want to constantly learn, and I want to constantly discover. And, I don't want to know it all. So those people who know it all, and those rights fighters who get in there, and those people, those crickets who think, wow, well, let them have it, because one day, they're going to get some kind of news like we got, and their whole world is going to change. Not that I wish it on them, and then they're going to reevaluate. And then after they reevaluate, they're going to go, you know what? That little pettiness was never worth it. It never got me anywhere anyway. But, we could tell them all day long, but nobody's going to listen to us, right?
Right. That's life lessons are individual things, and we can't be involved in other people's life lessons. That's between them and God. That's their life.
Absolutely. Absolutely. Well, I know it must be pretty late there for you, girl.
It is 2:30, yes.
And it's late here, so, but you know what? I'm gonna keep in touch. If you want, I can DM my phone number. I'd love to keep in touch with you. It's up to you. And I'm here, I'm here for you.
Yeah, absolutely. Yes.
I totally want to raise my hand and volunteer to be a part of your support system, definitely.
Thank you. And I will
Kick me,
be that.
girl. Kick me.
Thank you. I will be a support system for you too. That's something that I really feel good about doing.
Okay. Well, we can agree. We definitely can agree on that. I think this has been a wonderful conversation, and I really enjoy you coming on. And you're natural. You're not nervous. You look gorgeous. You're well spoken. You got this down, girl. Maybe you should live stream. Maybe you should consider doing that.
I might think about it. I'm
There
gonna
you go.
just one day at a time. I'll roll with the punches.
Okay. I'm not very good at all this software, but if you need me to help you get the windows open or whatever, I can certainly try to help. I still need help myself, but I'm willing to help. So, yeah, if you feel that you want to do that, I believe that, well, I will tell you this. Okay. I was told I needed 100 subscribers before I could live stream, but I found out that was incorrect. All you need to do is verify your account and you can immediately live stream. So you don't need 100 subscribers. And
Okay.
then, yeah, all you need to do is go through the verification process. And then you can immediately upload under 15 minutes of video without verification. But if you verify your account, you can upload over 20 minutes of video or something like that. It's pretty close to that.
Okay.
So all you have to do is verify with your email and your phone number and all that. Verify who you are with their standards, not anybody else's, but with YouTube standards. And it's very easy. And once you're verified, you're fine. And then you do your thing, girl. And I'll pop in. I'll come say hi. I'll live chat with you. And, if you're just cruising up the hill and want to talk live, do it. See who comes on. If you get 1 or 2 people, don't worry about it. I get 1 or 2 people, 3 or 4 people, whatever. You'll grow. And
yeah, and I'm not worried about big growth. I feel like that I'm the people that I'm meant to reach and meant to be connected with. I feel like that'll fall into place.
Absolutely. Me too. And there are a lot better YouTubers out there that can live stream and work their chat and go back and forth, and that chat's flying and those people are catching what they're saying, and you can say hello to them and they'll call out and say hello back. And those are my heroes. They're my YouTube heroes. They are like,
they're gifted. They are very
I'm bowing down to you. You got this thing and you are good at it. And I took notice, and good for you. I'm not that good. So I could barely work the chat and work this and work that and have a good conversation. Because there's one thing I'm not going to do is ask somebody to come on my panel and then not pay attention to you and not listen to what you've got to say.
right.
That I'm not going to do. And I was trying to pay attention to the chat and then listen to what you were saying. And I just feel I'm going to miss your story if I'm worrying about everybody. And I know you were doing better at paying paying attention to the chat than I was. And
I was really trying. If you could see the setup that I have here, where I'm doing the stream on my phone and watching the chat on my tablet, I'm really putting the effort into it.
Hi, Rennie. Oh my gosh. Rennie is in the house. I'm glad I just looked at this chat. Rennie is back, is in the house. Oh my gosh, Rennie, I love you. I'm so glad. Oh my gosh, I'm so glad she is back. Oh, girl.
Isn't she great? She's great.
Oh, Rennie. She is, isn't she? I was sitting here just so involved talking to you. My whole screen on my iPad where I was following the chat was totally black. I wasn't even paying attention. And then I hit the thing and I go, oh, Rennie! Oh my God. No,
She's so down to earth.
Rennie.
Tells
We don't
it like
want
it
you to
is.
leave. We seriously don't want you to go. My goodness. We love you to death. You are just so wonderful. And oh, she subscribed to you, Little Rosie.
I know. I saw that. I thanked her. I've been subscribed to her for a little while now.
And she hollered, "Hey, loves, hope everyone is well. World's best videos. Thank you. I subscribe to you, and subscribe back to World's Best Videos. They're wonderful."
Yes, I will
Thank
be
you for
subbing back
popping
to
in,
anybody.
Dennis. Gary Dennis, thank you for coming in. I'm so bad. I'm so bad at being able to manage everything. And just to keep in touch. Yes. Yes. Please. I hope Rennie, are you going to be making videos? Are you going to come back fully?
Oh, I really hope so. I hope so.
We love you. Oh, she said, I see. I know. I started a new channel. Oh, not sure yet. Okay, well, think about it. Think about it, girl.
Take your time, Rennie. Come back when you're comfortable. We understand.
Don't cut us all off. We'll see. Oh, think about it hard. You got people who love you, girl. I know her accent is just to die for, isn't it? I want to try to do that, but I can't. I'm not from Australia. But Rennie, my teacher is from Australia, and I bet you know who he is. No, you won't. I'm back to keep in touch. Randy, my teacher is Agent Brahm. I bet you know who he is. Agent Brahm. He is from Australia, taught under Agent Shaw. And he's very, very popular in Australia. And I love him. I took my percepts with him over the internet. And that is very big for me. Who is he? He's a Theravada Buddhist monk. He's a Theravada Buddhist monk. Agent Brahm. So,
how do you spell that, Sweet Meadow?
Theravada?
Yeah, I'd like to look into that, but I have no idea how to spell that.
Okay. It's Theravada.
Okay.
Theravada is a lineage of Buddhism that is, it's not Zen, it's Theravada means, the very word means the elders. And Theravada Buddhists don't even call themselves Buddhists. It's just they practice spiritual principles that allow us to still be Christians. I call myself a Christian Buddhist. I still wear my cross. I believe in Jesus. Um, you know, but the principles of that lineage Theravada Buddhism has helped me to just be a better person and practice basic spiritual principles in my daily life, and to make sure that I'm checking myself every day and taking responsibility for my part in things and keeping my side of the street clean and being the best person I could be.
Okay.
And he has, Rosie, if you go to my playlist on my channel, if you click on the playlist, I have a couple of his videos on fear and fearlessness that I posted right before I went into the hospital.
Okay.
For my procedure. And I posted them to my playlist so they would be there on my phone for me to listen while I was waiting.
Okay, I'll definitely look into those.
Yeah, and I'll post more of his. I listen to something I wake up at sunrise and do morning meditation, and I have a monastery that I drive 3.5 hours to, and I spend 5 days in the one of the casas there, and I'll spend 5 days at a time, pretty much once or twice, a year or something. But you have to be disciplined to follow all the monastery's guidelines, and that's in a whole nother video. But it's pretty cool to listen to the Dharma talks, and that's what I'm posting on my playlist. They're called Dharma talks, and you can really get some strength out of them. I mean, it's just wonderful common sense stuff that what we call layperson, which I'm a layperson, we often need reminding of these simple things.
Yeah.
And Ajahn Brahm often talks about cancer. And so he's one of my favorites, Well, he's my teacher, so. And he teaches under Ajahn Chah, which is a great master from Thailand. But that's who he is, Rennie, and he's from Australia. Anyway, well, I'm getting tired, and I'm sure you're beat, and so we should probably call it a night. And thank you so much.
Yes, thank you for having me on. I've really enjoyed it. It's been a really positive experience for me.
That's wonderful. And you look absolutely stunning.
Thank you.
I'm so glad to see you looking as good as you do, and just keep doing what you're doing, girl, and let us know how you are, from time to time. At least DM me, let me know how you're doing. If you need anything, please get a hold of me, okay?
And same to you. Same to you.
Okay. I promise. All right, you take care, sweetie.
You too. Thank you so much. Good night.
Good night.